Everybody, I'm going to call the meeting to order at 9:02, and I invite the Deputy Clerk of the Board to do the roll call.
Absolutely. Good morning. Supervisor Brown?
Here.
Supervisor McCowan?
Here.
Chair Haschak?
Here.
Supervisor Jurdy?
Here.
Supervisor Williams?
He's muted.
You're muted, Ted.
Sorry, I didn't have mute control.
That's okay. There you are. Hi, good morning. Okay. All present and accounted for. Thank you.
All right, I'd like to lead us in the Pledge of Allegiance. Ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, good morning, everybody. Just like to announce that in order to speak via telecomment, one must submit a speaker form online before 8 a.m. the day of the meeting. The link to the telecomment request forms can be found on both the first and last pages of the meeting agenda and on the Board of Supervisors website under Agenda and Minutes and Public Engagement. If you have submitted a telecomment request for either public expression or consent calendar, please call in now. I'd just like to say, first of all, that there was an agenda item submitted by Supervisor McCowan to repeal the cannabis cultivation ordinance. The cannabis ordinance is an incredibly important issue for our county. I appreciate Supervisor McCowan bringing that forward. The cannabis ordinance has been at the forefront of the Board of Supervisors for the last several years. The boardroom is packed when anything dealing with ordinance is before the board. I appreciate that there are items to address issues of concern with the ordinance before the board. Last week, we deferred phase 3 until April of 2021, unless we choose to take up the issue before then. I polled Supervisor McCowan's agenda item from the calendar for a couple of reasons. In February, the Cannabis Cultivation Ad Hoc Committee provided recommendations for changes to the ordinance. 3 of the recommendations were unanimously approved by the board and sent back to staff to work them into ordinance language. Those items have not yet returned to the board because, as staff has said, in this time of crisis, they haven't had the time to even deal with these recommendations. Staff is overworked dealing with the COVID-19 crisis. The other part of the ad hoc's recommendation concerning zoning and acreage, I submitted an agenda item in February and was told by the Deputy Clerk of the Board that it would not be heard until July due to overbooking of agenda items. I was quite surprised to see another cannabis cultivation agenda item, not from the ad hoc committee, come forward on the proposed agenda for this week. In late March, the board agreed that we should not be bringing controversial issues to be put on the agenda due to the lack of public input with these virtual meetings, demands on staff time for any agenda item to be processed, and then work needed to follow through, and of course, the need to focus on the pandemic issues. It was even said that we should be trusted to use our judgment to only bring the essential items forward. I felt that dealing with an agenda item to repeal the cannabis cultivation ordinance would be very controversial and not in the spirit of our board's conversation and direction. Cannabis growers need to have a pathway to legalization. Right now, no one can enter the program, but we are in the middle of a pandemic. A functioning democracy needs public input. As I've said numerous times, the system we are using has some glitches. We only had 2 comments for the postponement of phase 3. No one signed up for public comment today. No one knows how long this pandemic will go on. We need to do our best to ensure that democracy is upheld and the public voice is heard. I would like to work with the CEO and clerk of the board to come up with different approaches to improve the public's ability to make comments and directly interact with the board. With that said, I propose to have a special half-day meeting to deal with the different items relating to cannabis cultivation that are out there waiting their turn. I am determined to give the public time to consider, review, and understand what is being proposed. It would give the board time to see what the implications would be for any changes and give staff time to catch up on the items that the board has already approved. I can see this happening sometime in July with the hope that the COVID-19 crisis is somewhat behind us, that we are functioning smoothly as a democratic institution, and that we are recognizing the importance of public input into our decision-making. We will have this discussion later today to try to set up a special meeting of this nature, and I will do it either before lunch or at the end of the meeting. But I really am committed to making sure that we have public comment and we do this the right way and honor what the board has said beforehand. So with that, we're going to move on to agenda item number 3, public expression. And like I said before, that we don't have any comments. So we're going to move on to agenda item number 4, which is
Mr. Chair. Mr. Chair, I actually do have a very brief comment.
Well, we're on to consent calendar number 4, and we can deal with that later when we bring up the issue about the meetings, Supervisor McCowan.
Well, Mr. Chair,
moving on to consent calendar number item 4. Has proper notice been established?
Yes, proper notice has been established.
Okay. Are there any items to pull for separate consideration?
Yes, Mr. Chair, I would like to pull item 4X, and rather than discuss it separately in advance of our regular calendar, I suggest we combine that discussion with item 5G, which is a very closely related item. Thank you.
So you want to pull item 4X and discuss it with 5G?
If that's acceptable, yes. Thank you.
Okay. Very good. Supervisor Williams.
So sorry, I try to mute myself to mitigate background noise, but I can't unmute. So don't take offense if I don't respond. I wanted to pull 4X. Supervisor McCowan already covered it.
Okay. Anything else?
I do have a comment, Mr. Chair. I have a comment to 4H and 4T when you're ready to hear it.
4H and 4G?
T.
T. Okay. Yeah. Anything else need to be pulled for comment or consideration?
Mr. Chair?
Oh, yes.
This is Supervisor Brown. We do have a proclamation that is within our consent calendar. It's recognizing Mental Health Month here in Mendocino County. The Behavior Health Advisory Board will be meeting tomorrow, and I hope you can be on that line to read the proclamation under public comment, which is at the top of their agenda. Thank you.
That's very good. I'm planning on doing that, and that's item 4Q. Okay, thank you for bringing that up. So going back to Supervisor McCowan, item 4H. Supervisor McCowan.
Oh, I'm sorry, I was on mute. 4H is part of the emergency homeless funding that was made available to the county by Governor Newsom. approximately 140,000. Supervisor Jurdy and I, as the Homeless Action Ad Hoc, met with the co-chairs of the Continuum of Care and with Director Tammy Moss Chandler and staff to review their recommendations for utilization of that funding to address COVID-related homelessness expenses that the county's incurred. 4H is actually the ratification of acceptance of the funding. And if I may, I'll combine my comment to item 4T. That applies to the Continuum of Care, approximately 152,000. Same thing, the item is for acceptance of the funding. The CFC has recommended how those funds ought to be expended. The county doesn't have direct control over how the CFC funds would be spent. We would approve as their fiscal agent dispersal of the funds. So in both cases, there will be recommendations coming forward on a subsequent agenda. Given the process that has been followed, I'm suggesting that if the relevant staff are comfortable putting those items on consent, that they do so. And of course, any board member can review them. And if they seem fine, they can stay on consent. Otherwise, they could be pulled. But I think you'll probably find when those items come forward, they are pretty routine and non-controversial. And I appreciate all the staff work that has gone into those items. Thank you.
All right. Any other comments? Okay, so we're going to, I'm looking for a motion to approve everything except for 4X.
So moved.
Is there a second?
I'll second, Mr. Chair.
All right, it's been moved and seconded. Okay, can we have well, there's no public comment. So can we do a roll call vote?
Yes. Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Supervisor Jurdy? Supervisor Jurdy? You are muted.
Yes.
Okay, thank you. Supervisor Williams?
Yes.
Okay, and Chair Hashtak?
Yes.
The motion carries unanimously.
All right, very good. Moving on to item 5A, discussion and possible action, including an update associated with the novel coronavirus, COVID-19, including possible direction regarding essential services in Mendocino County, including operational preparation and response, and an update on county continuity of operations and services. Sponsor is the Executive Office. And so I'm going to turn this over to Carmel Angelo. Thank you.
Thank you,
CEO
Chair.
Angelo.
Thank you, Chair Hashtak. Before Dr. Dewan gives her update, I would just like to say that this board has heard on and on and on about our testing issues, and we certainly are very appreciative of Senator McGuire and Assemblyman Wood for their assistance. Our OptumServe implementation will happen by next week. We have been having daily calls with the state and OptumServe, and we are in the process of finalizing an agreement with the fairgrounds, and OptumServe testing will be open to the public next week. So I'm very pleased to be able to say that to this board. Your implementation team is working to get this all done. Again, it will be at the fairgrounds, and next week we will start with OptumServe testing Tuesday through Saturday, 7 a.m. to 7 p.m. We are looking at scheduling blocks of time from 7 a.m. to noon for our first responders, our firefighters, public safety, emergency operations staff, departmental operations response staff, and then in the afternoons having it open to the public. There will be numbers and a website that will be advertised here within the next day or two that will list the number to call to make an appointment or to go online and make an appointment. It is recommended that you make an appointment for testing rather than just walking in. It's very common with the OptumServe sites that once they open, that they're booked out for a couple weeks. We have the ability to test 134 people daily at the fairgrounds now with OptumServe. Should there be more demand, we have the ability to increase those numbers. So we are very pleased about this. We're actually relieved that we have this ability. I would also like to say that for the outlying areas in the county, 3,510 square miles, that those outlying areas that still require testing, where people cannot get to the Ukiah Valley, we do have trained staff that will still be doing testing off-site. But if you are anywhere in the Ukiah Valley and you have the ability to get to the fairgrounds, we request that you go ahead and schedule appointments. And the testing is free, and this is a great service that is provided by the state to the counties and the counties to the public. There are approximately 86 OptumServe sites throughout California, and they have approximately 80 sites implemented already. We know that OptumServe is up in Humboldt, and it's also in Sonoma County. So again, we're very relieved and satisfied with the response we've gotten from the state. Senator McGuire, Assemblymember Wood for their assistance, and we should go live on Tuesday for the public. So that's my report for today. Chair Hashtag, thank you.
All right. Thank you, CEO Angelo. Thank you for your advocacy at the state level and for our partners, Senator McGuire and Assemblymember Wood, and the people who made calls and emails and put some pressure on the state too. So I appreciate that very much. Dr. Doohan. Dr. Doohan.
Can you hear me?
Yes.
Hello.
Good morning.
Good morning. Good morning, Chair Hashtag, Board of Supervisors, CEO Carmel Angelo, County Council. It's my honor to speak to you today. I understand this may be one of the last times that I will be speaking to you as your health officer. So I want to take a couple moments to tell you that it has been an honor to serve during this historic time. When I joined as health officer, I did not expect to be entering a pandemic, and neither did any of us. And I don't have time today to list all of the people that have worked so closely under my leadership in the EOC and now the DOC. But this team of individuals has worked tirelessly for 19 weeks now, that we have worked without breaks, without weekends, at night. And I just am forever grateful to the experience that I've had to serve with this team. To give you an example of the service, for example, on April 7th, 2020, I got a text message at 3 a.m. from Dr. Hiramatsu, the emergency physician director, saying that there was a patient she had seen in the emergency department that worked with a homeless population at Plowshares, and she was convinced this individual had COVID-19. At that time, it was very difficult to do testing. There was a lot of constraints. We didn't have swabs necessarily or viral transport medium. But I told my team that I wanted within 48 hours to stand up, drive through or walk through testing at Plowshares. And without a hesitation, they worked tirelessly to put up our very first surveillance testing at Plowshares several days later, where we collected samples on over nearly 30 people, and were able to determine that that individual who worked at Plowshares, in fact, did not have COVID, and neither did any of the people that went to Plowshares that day for services or any of the workers. So that was our very first surveillance testing, was stood up very quickly. Now let's skip forward to today. On Friday evening, we got report that there was a new positive test of a case that's been reported now as our 14th case. I again went to my team. I said, we need to immediately start case investigation, contact tracing. We need to find out who this individual has been in close contact with, get those people to testing. The team worked tirelessly over the weekend, and within 24 hours, we were able to announce a press release with the information that we had that this individual was safe at home, but had 2 close contacts that were from Lake County, and indeed one of them was hospitalized in Ukiah. Now, a couple days later, so we're talking Friday night, we got the information about this 14th case. Now it's Tuesday, right as we speak, right now, there's a very successful drive-through testing operation happening in Redwood Valley. Well, when I got a report from my now volunteer, Dr. Flaherty, as he drove into that site, there was a line of cars at 7 in the morning being tested. This is a testament to the tremendous work of our DOC, which is now under the strong leadership of Becky Emery. And I want to say to all of you on our team, thank you. Thank you for allowing me to lead. Thank you for doing such a tremendous job. So tremendous that the governor called out Mendocino County in one of his press conferences as a leader in rural health in California in the pandemic response. So now, as you all know, my term as health officer has been slated to end on June 4th by this Board of Supervisors who I serve. And I'm very grateful that after months and months of posting a full-time health officer to replace me, an exceptional candidate has come forward, Dr. Iser. Dr. Iser came to my attention because Kat DeBerg, who is the executive director of the Health Officers Association of California, CCLHO, told Dr. Iser, who's highly regarded at the level of our state, that there was an opening and urged him to apply, as well as Karen Smith, who was the former health officer director for our entire state of California under Governor Brown, and currently is working not only for Google, but for us as a consultant, as well as for Santa Clara County as a consultant. Both Dr. Smith and Kat DeBerg, who are exceptional leaders in the state of California for public health, recommended Dr. Iser to me, as well as Dr. Gary Pace, the Lake County health officer. I consider it an incredible great fortune that Dr. Iser is ready to relocate full-time to Mendocino County and be our health officer. And I do know that this is coming before the board today. And I urge you, Board of Supervisors, to vote him in as our next health officer. And then I can continue in my role as a consultant after June 1st, working with Dr. Iser to support his transition. I also would like to highlight that there is an exceptional resource called the Disaster Health Volunteers that is set up through NCO. And through this organization, physicians and other clinicians can volunteer to help in our pandemic response. I'm tremendously grateful to the generosity and leadership of Dr. Flaherty, who has, since his contract is being reconsidered, essentially he worked so many hours that he used up the contract that we initially had for him, and a new contract is in the works. But showing the great character and integrity of Dr. Flaherty, what he did is he signed up with Disaster Health Volunteers, and he is volunteering with us. And right now, he is in Redwood Valley participating in that drive-through testing. Thank you, Dr. Flaherty. And for those other physicians in the community who wish to be more involved on the front lines of this pandemic response, who want to know that they're involved in the decision-making processes of the leader, which is the health officer, I encourage you to sign up for the Disaster Health Volunteers, as is being done across our state and our country. And to bring out that there was an article that was sent to me recently from the New York Times called Remote and Ready to Fight Coronavirus's Next Wave. This is an article about rural Washington state, where volunteers to an organization like Disaster Health Volunteers are leading the response to COVID-19 in rural areas. So please, my physician colleagues, please sign up and volunteer with us. We need your help and we need your input, and we appreciate all that you're doing on the front lines every day. I do want to I know we have limited time, so we have a lot to discuss. There's so much in COVID. It's a rapidly evolving situation. We still have no vaccine. We do not have a curative treatment. Many of you have heard about remdesivir, which is the only treatment that we have approved at this time for COVID, which is not curative, but it does appear to shorten the course of COVID. 17,000 doses of remdesivir have been given to the state of California to be distributed through the MOACs to the regions and counties where there have been cases in the hospital. None of these doses have been slated to come to Mendocino County at this time, but I have directed our MOAC to definitely put us on the list to receive remdesivir in the future. The current 17,000 doses would treat 1,700 patients in the state of California. There will be more allocations coming in the weeks to come. I've spoken to you many times about how COVID has been a rapidly evolving situation. It has never ceased to be rapidly evolving. And in this pandemic, there have been two essential elements to our response. One is containment and one is mitigation. On every single point of containment and mitigation strategies, Mendocino County has continued to hit hard. We've done everything we can, and we have done so without fail and without rest. The first, containment, isolation and quarantine. Every single time we have a case, our CD team, our case investigators and contact tracers reach out, make sure that the individual who is a case is isolated and their contacts are quarantined, and our public health department reaches out daily to support these individuals. I also have blanket isolation and quarantine orders, which are enforceable orders to make sure that individuals with COVID and their contacts are isolated and quarantined. These orders help our healthcare partners to make sure these individuals are away from the public and are safe. In terms of testing, we have been absolutely on the front line. We are working with the public health lab in Sonoma as well as the state lab in Richmond. Our clinics and hospitals are doing testing, which public health department helps facilitate when needed. We have surveillance testing ongoing today, as I just mentioned. In terms of the surveillance testing, we've done 1,191 tests. 270 of those surveillance tests are pending, 152 are negative, and 2 were positive, which are counted in our 14 positive cases for the county. The surveillance testing at this time is done through UCSF, a free program, and we again have been on the front lines of participating in every possible resource that we can. And the fact that we are now getting OptumServe is a tremendous achievement. It's something that we're very, very proud of and was involved. Every part of our DOC has been involved in this achievement, and our whole county will benefit from this starting this week. Another part of containment is alternative care sites. We have Whitmore Lane stood up and ready to be an isolation and quarantine site the moment it is needed. Thankfully, we have not needed this resource yet because all of our cases have been able to isolate at home. We've not had any outbreaks in vulnerable settings like jails or skilled nursing facilities, but we have the ACS Whitmore Lane ready to go. In terms of case investigation and contact tracing, we did a training with the County a month ago. We had the California Rural Indian Health Board do a training with us when we were responding to the outbreak with our partners at Round Valley Indian Health several weeks ago. And now we are participating in the California Department of Public Health, University of California, San Francisco, case investigation, contact tracing. We're in the queue to be the next round of counties involved in tracing, which will happen next week. In this training, we also have been absolutely on top of the need through our MOOC to make sure we have sufficient PPE and surge capacity. And so regarding containment, we have done every single thing possible to contain and respond to COVID as it comes into our county. We have 14 cases, no deaths. Regarding mitigation, that's our sheltering in place orders. Those are our facial coverings orders, our medical masking orders, our social distancing hygiene protocols for businesses. I completed the version 5 of sheltering in place order last Friday. Version 6 will come out this Friday. So social distancing, wearing of facial coverings, all of these things that Mendocino County has worked together so hard to do, we are doing everything we can. And in fact, that is revealed in the fact that we're holding strong with only 14 cases and no deaths in our county, and that we have done such widespread testing. 2,227 negative tests for our county at this point. The 14 positives, including in the surveillance testing I mentioned earlier. So I know that on the top of many of your minds is attestation. I know that I agreed at this Board of Supervisors meeting to present you with our plan for attestation. Well, the fact is that we have excellent news due to the strong team and leadership that we have in our DOC. Our attestation paperwork is ready to submit. It's just pending a final review by me, which will be done after this meeting today. It's been completed. We had our call with the state yesterday. The state reviewed our paperwork and gave us a very strong rating. And so we are absolutely prepared to do exactly what I promised last week and ahead of schedule. So that attestation is going to be submitted tonight or early in the morning. and it will be, according to the state, reviewed and posted on the website there at the state within 1 to 3 days. And I have learned from my health officer colleagues that while it is said that the state does not need to approve the attestation, in fact, until it appears on the county website, the CDPH website, it is actually not theoretically approved. So we do have to wait for it to appear on the CDPH website to be officially allowed to move forward. So we will be waiting for that. It should happen Friday or Monday, and then we'll be ready to go with my 6th sheltering in place order, which will allow retail to open up for shopping inside their stores and restaurants to have in-restaurant dining per the guidelines of the governor. Now, for those of you who follow the governor closely, you'll know that a couple of days ago, he announced a new attestation round and new possibilities for further limited reopening. So again, the pace continues to be rapidly evolving in this pandemic. The new attestation process has to wait for 2 weeks after the first one. So we will be submitting our first round tomorrow, and then we will have 2 weeks to prepare the second round of attestation, and then we can do the next round of further reopening. This is what I understand from the many conference calls I've been on the state with my colleagues in the last several days. The new attestation process is a bit difficult to understand and is being clarified by the state. But anyhow, look for a second round of attestation to be coming up in the next week or two. I am very grateful to the West Company and the ad hoc of the Board of Supervisors for working so closely with me to help the business community to prepare for limited reopening. You will be hearing more about this in the future, but it is something we can be very, very proud of. And I'm convinced that other jurisdictions around the state will look to Mendocino County and the very strong work that West Company did with our ad hoc to lead our business community. In essence, this will be a self-certification process that businesses will go through to certify that they are ready for reopening. And so we are working actively right now with the West Company and ad hoc and with industry leaders from the community to make sure our businesses are safe and can serve our public in a way that is safe for our public. Other meetings that I have with frequency, for example, are with the school superintendents. I'm so grateful to their leadership as we enter into graduation season, and the superintendents have done a fantastic job of making sure that their graduates are able to have a meaningful graduation ceremony this year without being in violation of the governor's order that does not allow gatherings. And they have worked closely with me to make sure that my sheltering in place orders allow for safe and joyful graduation with processionals in vehicles and other very creative things that the superintendents have done. So thank you to them. I've also met with the city managers regularly, and I'm grateful for them for their input and their wisdom about how, from the position of being your health officer, I can best serve the cities. Also, we had a very important meeting this week with Eversole Mortuary. I'm so grateful to the leadership there, because there was a tragic death of a young woman in our community who was buried on Monday. And Eversole and the community, thank you so much, and my condolences to the family. But what was done was absolutely safe, and I'm just very grateful for that. For City of 10,000 Buddhas, I'll be meeting with them again this afternoon. I want to say what exemplary leaders they have been, with no cases, no outbreaks, and nothing involved with the City of 10,000 Buddhas of anything except the absolute exemplary behavior they've had from the very beginning of this pandemic. So you'll be seeing a sixth sheltering in place order coming out on Friday, which will be in alignment with the attestation that I'm submitting this week. In the fifth version, which came out last Friday, there were some concepts introduced that I don't have time to discuss now, but I will say that with my meetings with the media, which are regular and weekly, I will be discussing more this week on social bubbles and work units. And these are a way to get stable groups of 12 able to participate in a more normal ways in our daily life, especially focusing on our children in their childcare unit bubbles and their extracurricular activity unit bubbles, which will allow, for example, a child to have one extracurricular activity, such as Little League practice. And I'm very grateful that Little League will be able to resume. Regarding Covelo, I want to say that we have not found any new cases there. We continue to do surveillance testing. So we have had our 7 cases who have recovered there. And we did testing again yesterday. 60 people were tested from the general community, and we will be awaiting those tests. So I think that is my report, other than to just summarize with some data. In the Bay Area, we have over 10,000 cases. We've had 388 deaths in the greater Bay Area, and that's a death rate of 3.6% of those people who have tested positive. 3.6% unfortunately tragically have died. In Napa, we have 90 cases and 3 deaths. Marin, 316 cases and 14 deaths. Humboldt, 77 cases and a death just announced in an assisted living, which is very concerning. Sonoma, 373 cases and 4 deaths. Lake, 8 cases and 0 deaths. Mendocino County, 14 cases and 0 deaths. As you can see, we're surrounded by the pandemic, yet we're holding strong. We have our firewall built with excellent testing and all the containment and mitigation strategies I've shared with you. And again, it's been an honor to serve. Thank you.
Well, thank you, Dr. Duhan. Really, on behalf of the Board of Supervisors, I want to thank you for all the work that you've done. You certainly stepped into a job you had no idea where it was going to go with this pandemic. And it hasn't been easy with the shelter-in-place orders and the public health orders in general throughout this country. But we very much appreciate all your dedication to the County of Mendocino for helping to keep us safe and healthy and prepared for whatever might lie ahead of us too. So on behalf of the Board of Supervisors, I want to thank you very much.
Thank you, sir.
And moving on to Deputy CEO Darcy Antle with the fiscal update.
Good morning, Chair Hashak, members of the board. I would like to, this is Darcy Antle, Deputy CEO. I would like to start with a comment of my respect for CEO Angelo, who works tirelessly to keep staff focused on the task at hand of fighting for our community against the COVID virus without losing sight of the future. The future of wildfire season, PSPS events, and the state budget, which is going to create some challenging fiscal years ahead. At this time, I have a presentation that was put together by our EOC fiscal finance team. So the last fiscal report of this nature was presented to you on April 14th. So I'm going to do some slight comparisons to that. There we go. So here you can see this is the expense by department item that is in the Munis system. Compared to the April 14th presentation, the increase of expenditures is $1.3 million. Going to the second slide, and again, I think, hold on, not a second. On this, I want to point out the $960,000, that is CTO and overtime only. That is not the complete hours. Because we are disaster healthcare service workers, our regular hours are not counted. Okay, thank you.
May I ask a question?
Yes.
Okay.
Ms. Antle, the presentation that you're giving was not on the agenda, that I can open it and preview it, or is it there and I need to close out and go back?
I will defer to the clerk of the board.
This will be reattached to the item and pushed to the public. Give me just a couple minutes on that.
Supervisor Brown, is it all right if we continue on?
Of course.
Okay.
Thank you. Thank you. So this slide, you will see the public health vouchers. This is our project room key. The work that we have done here through the HHSA committee is an increase of $350,000, and we have hoteled 305 residents. At the bottom of the slide, you'll see the COVID-19 contract expenditures. We have $2.1 million in contracts with an expense payout to date of $634,000. Again, these contracts include our public health officer, nursing that is out helping doing the testing today, N95 mask, and sign language, among other items. This is a new slide. We did not have this hours slide last time. So you can see how we do track all the regular hours. The regular hours to date are 31,000, but the total hours, overtime, and COT by department is totaled over 37,000 hours. That's an increase of 12,000 hours from last month. On the red side, you can see we highlighted those departments that are significantly putting in hours. Again, public health, sheriff's office, other HHSA departments, and we would be amiss not to give a shout out to the library, who at this time is working in the DOC and was working in the EOC and is great temperature checkers. They are really manning our doors and keeping us all safe. At the bottom, you will see our Zoom hours have increased as well in the number of users. On the next slide, this is the FEMA obligation and our projects that we have submitted to FEMA, -1. So to date, we have completed 4 projects in the FEMA grants portal. Again, the EOC, the alternate care site, project room key, and just yesterday, I submitted our Great Plates delivery. This is where we can work with the local restaurants to deliver food to those that are unable to get out and get meals. At this point, we have over 150 folks signed up for that. And I think we have reached out to over 150 restaurants with 3 contracts completed to date. We are going to be submitting another project. Again, this is for food insecurity during the shelter in place and the purchase of personal hygiene items. On the next slide, again, last time when I was here in April, we discussed tracking some revenues. So we always look at our planning and building department as they are one of the larger fee collections departments that we have. So on the top, you'll see the planning fees, and those are for codes, compliance. You can see in January and February, we were on a nice trend for 2020. And then you can see the decline in March and April. This is very much what you will see when we discuss the budget further in June. The building fees, similar trend, and those are for building code compliance. So at this time, again, I'd like to thank the EOC finance team for all their work. We're a collection of about 8 folks from 4 different departments that have come together to do this work for you, and it has worked out really well. Everybody's working together, much like the DOC. The DOC does have strong leadership, as Dr. Doohan had mentioned. That's the end of my report.
All right. Thank you, Deputy CEO Ansel.
Excuse me, Mr. Chair. That presentation was the second attachment on this item. So if you all will just refresh your iPads, I'm sure you'll see that it's there.
And what is it called? Is it the COVID-19 related expenses?
Yes, it is. And that was attachment number 2. Yes.
Okay. Very good. So we don't have any public comments. We're going to go for board comments. So Supervisor Brown.
I may have some in after hearing the other supervisors, but none right now.
Okay. Supervisor McCowan.
Thank you, Mr. Chair. Last week, we actually had requested that the attestation document, to the degree that it was completed, be posted to the agenda. And it's great news. Thank you, Dr. Duhan and everyone else involved for having the document completed pending final review. My question would be, once that review has taken place and the document has final approval, it might be appropriate to post it, even though it might be after the fact. So that'll be a question for clerk of the board and county council. But if there's no reason that it couldn't be posted to today's agenda item, I would request that we do that. And of course, alternately, we could post it to the website. So that's just in the nature of a comment and request. Thank you for that. I would appreciate it, briefly, if we could go over again the further attestation process. So it's mainly just, do I have this right or not? With the subsequent attestation process, then that potentially would allow counties who have their process posted to start moving into phase 3. Is that how that would work? Or please correct me, my understanding if I'm wrong on that. Thank you.
If I may, Mr. Chair.
Yes, County Council.
Thank you. So the language from the state seems to shift a little bit from time to time. For example, we've had what we've called, I've been calling stage 2.5. I think the governor might have referred to it as stage 2+. I will say, Supervisor McCowan, you are correct that some of the activities that would be authorized with the subsequent attestation were things that had previously been identified as stage 3 activities, but we don't know at this point exactly how much of that is what's going to be allowed. The parameters are sort of evolving as we continue to get more information from the state.
Thank you. And one follow-up on timing. So there was mention of 2 weeks between attestation. So although this may be shifting as well at the state level, but does it seem like once we submit this document and it's reviewed and California Department of Public Health posts it to their website, does that mean, as far as we know now, would we have to wait 2 weeks before we could submit a subsequent attestation process? Or would it be 2 weeks from the window for attestation opening? Do we know the answer to that one? And thank you.
And again, if I may, Mr. Chair, I'm sorry, I don't know off the top of my head. I'd have to take a look at the documents to find exactly when those time periods are running.
For one final one, just a request for public information. Could we post to this agenda item the latest state advisory on what this future attestation process may look like, assuming there is such a document? Thank you.
All right. Supervisor Jurdy.
Well, excuse me, I'd like to know, does that document from the state exist? and then potentially could we post it to this item? Thank you.
County Counsel?
Janelle Rao, Deputy CEO. What I can tell you is that the information has been evolving. We received a press release from the governor's office late yesterday afternoon, and there are some draft documents floating around. These were not in our possession in order to post these to meet the Brown Act, but I'll defer to County Counsel if he would be okay with us posting us to this document, to this item.
And I just need to review the specific documents that we might potentially be posting. The information has come in sort of a few different formats, so we just need to make sure that the documents we'd be posting would be both a public record, but also something that is actually useful to the public and not potentially misleading.
Okay. Thank you. Supervisor Jurdy.
Yeah, thank you. I'd like to just add a little bit to Dr. Duan's report of the work of the ad hoc and West Company and Dr. Duan and others. For the benefit of the businesses that may be watching our meeting today, we've done everything we can to get some initial feedback from businesses in creating a form. It's actually a web page where businesses will be soon able to go to that web page, and they will be able to see recommendations from their industry and from the state and from the county about how they could operate their business safely. And we're in the process of, West Company is in the process of scheduling additional meetings with industry leaders, say restaurants, retail, that kind of, those types of businesses and others, to get their input and to provide that for other businesses to see their suggestions. And so we're hoping that, the timeline keeps moving very quickly on this. West Company and the ad hoc, Dr. Duan, we all worked over the weekend, and West Company was able to, again, create this website over the weekend. It was lightning speed by county standards. And so we're really pleased with the work that they've done. And I don't know if Dr. Duan has anything more to add in terms of when she understands what's her recommendation for when West Company posts that links to that website? Is it later today? Is it later tomorrow? Again, these timeframes keep moving up a bit, and which is great.
So is Dr. Duhan there?
No, she is not.
Okay,
maybe I could ask, is Miriam Petrillo from West Company going to be part of this discussion?
No, she is not.
Okay.
Supervisor Jurdy, we can screen share if you'd like to show the public the site.
Go ahead, Supervisor Williams. Yeah.
Supervisor Jurdy, do you want to talk about it as I share it?
Well, you're giving people a sneak peek, a preview of a web page. It's not clear to me whether or not we're going to be posting a link to this publicly today or not. Have you heard anything since our meeting yesterday, Supervisor Williams?
So my understanding is the goal is to have the links in place and the site finalized by end of day. But it's every effort is being made. It could extend into tomorrow. And so we have a website that'll be going live that has contacts, both industry contacts and county contacts. The idea is the individual industries are best suited to work with their own businesses on meeting the requirements. On the left pane are links to all of the best practices for the various types of industries. For example, for restaurants, when to wear masks, how to space customers, best practices for cleaning, how to clean credit card machines. And then businesses will come through this site to self-certify. And so they'll be able to choose what type of business, provide their business name, business license. This is so that if a complaint comes into code enforcement, code enforcement can quickly check to see that the business has self-certified that they're in compliance with the requirements. We also plan to give public access to see which businesses have certified, and a number of other links to the specific requirements are pending. And it's pending because we're waiting on final word from the state as far as, say, restaurants or retail or lodging.
And I believe the intent, I don't know if it's on the live version or not, but the intent is that if a type of business is not yet allowed to open and there are no guidances for those businesses, that as they select their business type, it'll show that type of business has no guidance yet, so that they won't unintentionally fill out a form that's not really relevant to their industry yet. So I'm not sure if they've activated that portion of the website, but that's the intent.
Supervisors Williams and Jurdy, this is Supervisor Brown. I talked with the Wine Growers Association for our county, their administrator yesterday, and gave her the information that you're the ad hoc. They're still waiting for information and basically a directive coming out from the Wine Institute on how best to keep tasting rooms open and what activities and how to have them, everything you're talking about. So I hope that when that comes through, contact will be made and it can be posted as well.
Absolutely. And you may want to put them in contact with us. Feel free to give them my cell number or Supervisor Jardy's, and
yes,
we will make sure they're part of the discussion.
I already did that, and thank you.
And along those lines, have the Chamber of Commerce has been involved in this process?
They have, to the extent possible. My understanding is we obviously had some meetings where not everybody was given notice. So we had several meetings in short order. It's our intention and West Company's intention to circle back with all the people that were invited to at least some of the meetings to make sure they have a chance to give some input, I believe either today or tomorrow, to this draft website.
Okay, thank you. Anything else, Supervisor Jurdy?
No, I just again like to emphasize that I really appreciate the work of everybody involved and the fact that the website was put together over the weekend and ready for launch.
All right. Supervisor Williams.
Yeah, as part of the collaboration, West Company put out an economic injury survey, and it's being prepared for publication, but in brief, there were 409 respondents. These are businesses, and they represent, they believe they represent about $17 million in lost revenue, with 57 employees permanently laid off. 28% of them applied for the PPP program. Another 37% applied for the EIDL. The highest concentration of survey results were from the cities of Ukiah and Fort Bragg and the town of Mendocino. 72% of the businesses responding said that if they're allowed to reopen in the next 60 days, they do not plan to close. And then last, 69% said that they will close permanently if the shelter in place goes beyond 6 months. Separate, I submitted as correspondence to the board the results of a survey I conducted. It was mostly electronic through email lists and social media. And so I'm putting that out as a qualifier. It may not be representational of the population at large, but it did have 2005 individual responses. And I wanted to share that with the board. The first questions qualify which district, the gender, and age to tell us a little bit about how the results may be biased. But largely, I was surprised that the feedback didn't match with a lot of the correspondence I receive in my mailbox daily. And I think it's an ongoing problem that we have various vocal minorities, and it's always difficult to get a sense of where the people at large stand in the county. So, take it with a grain of salt, but I think it may act as a catalyst to motivate the county to do some more proper surveying as we transition through COVID and recovery.
Okay. Yeah, I was just looking at it right now. Interesting results. Okay. Anything else, Supervisor Williams?
No, but I too am very thankful that staff has worked through the weekend. I'm aware of how many people are working 14-hour days and how many people have not received a break, 100 days plus without a day off. And I'm very pleased that the attestation has moved along as quick as it has.
And okay, so I'll go back to myself. And with the attestation, we have this letter. And so do we need to provide direction? This is a question to County Council for signing the letter and attesting to what Dr. Duhan comes up with.
Yes, Mr. Chair. I would suggest actually that the board make a motion authorizing the chair to sign the letter and to have it be submitted as part of the attestation packet.
So move.
So move. Second.
Okay, so well, we don't have any public comment, so we will take that motion to approve the letter being signed by Supervisor Brown, seconded by Supervisor Williams.
No, McCowan.
McCowan. So is there, Deputy Clerk of the Board, could you do a roll call vote on that?
Absolutely. Supervisor McCowan?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
Chair Hashchak?
Yes.
And Supervisor Brown?
Yes.
The motion carries unanimously.
All right. Are there any other questions for any of the speakers so far about the COVID-19?
I have one comment, sir.
Yes, Supervisor Brown.
And this is for the ad hoc. There is supposed to be at a state level with the different departments that direction for businesses to follow once the reopening happens. And for one, could be salons. They already have regulation, but I believe it's further. So, the ad hoc should investigate that. I don't know if it'd be through CSAC or the Rural Counties Association, but I've heard it on a number of phone calls I've been on at the state level. So it would be good to seek some of that out.
All right. Anything else from the board? Hearing none, we will thank all the participants, the presenters so far. Thank you, CEO Angelo and Dr. Duhan and Deputy CEO Darcy Antle. These are certainly trying times, and you all have very, very much stepped up and led the way through this. So thank you very much for all your effort.
Mr. Chair?
Yes, Supervisor Brown.
Thank you, sir. And I just want to go back to public comment. I wasn't quick enough as you were moving on, but you said no public comment, but I think there was, as far as written, that was attached in that section. And those people should be recognized that the correspondent is there. And so in further meetings, I think that needs to be read into the record. Not their comment, but at least their name, and it's been received. Thank you.
Very good. Yes, we have certainly received a lot of comments about the COVID-19 and everything related to it. So,
and Mr. Chair, I'd like to make two suggestions for future updates, if I may. First of all, the wording of this agenda item is actually pretty narrow and could be construed to focus primarily, if not exclusively, on the county's response as it relates to county operations. So, it can be read more liberally. I think a better practice would be to rework the way this update is stated so that it clearly allows for the full range of discussion of COVID-related items. So suggestion number one. Suggestion number two, instead of when we have a series of speakers reporting, particularly when it's very detailed and on different topics, as we had today, CEO Angelo primarily on testing, Dr. Duhan on all of the work she's been doing in the attestation, Darcy Annell on the fiscal implications. I think it'd be actually more transparent and more inviting of comment and discussion if we see if there's comment after each of those items rather than wait until the end. Suggestions for you to discuss with the agenda team. Thank you.
Okay, thank you. All right, so moving on to agenda item 5B, discussion and possible action, including adoption of resolution authorizing the Mendocino County Health and Human Services Agency Director to sign agreement number 20-10185 with the California Department of Healthcare Services in the amount of $3,649,500, $1,216,500 each year for 3 years to allow Mendocino County Behavioral Health and Recovery Services to contract with Partnership Health Plan of California to administer drug Medi-Cal organized delivery system services on behalf of Mendocino County to Medi-Cal beneficiaries through the utilization of federal and state funds available for reimbursement covered services rendered by certified DMC providers effective July 1st, 2020 through June 30th, 2023. The sponsor is Health and Human Services.
A proper order would be discussion of 5C previous, because that's approving a contract. And then the B would come next. So I think it's out of order, but I'll leave it to you, County Council, to decide.
Let's see, County Council, do you have an opinion on this?
Thank you, Mr. Chair. Frankly, I think that the board might be able to take these in either order or together. At the moment, I'm not seeing something that gives me concern in terms of the order of which the items are taken.
Okay, Supervisor Brown, would it help if we took them both at the same time?
That would work for me, but it's saying that, basically in B, it's approving an action and also a resolution to go to the state on the action that we'll be taking in C. So that was my main point. I don't mind that they're taken together.
Okay, why don't we take these together? So item 5C is discussion and possible action, including authorization for Mendocino County Health and Human Services Agency Director to sign agreement with Partnership Health Plan of California in the amount of $3,965,362, $1,321,787.30 each year for 3 years to allow Partnership Health Plan of California to administer drug Medi-Cal organized delivery system services on behalf of Mendocino County to Medi-Cal beneficiaries through the utilization of federal, state, and county realignment funds available for reimbursement covered services rendered by certified DMC providers, and to sign agreement with Partnership Health Plan of California to contract with Mendocino County Behavioral Health and Recovery Services as a provider to provide substance use disorders treatment services to Medi-Cal beneficiaries effective July 1st, 2020 through June 30th, 2023. Again, the sponsor is the Health and Human Services Agency. So I will call upon Director Moss Chandler to speak to this.
Chair Hashjack, Tammy
Yes,
Moss
CEO.
Chandler, this is CEO Angelo. Tammy Moss Chandler needs a few minutes to get into the meeting. So I don't know if you would like to take a break at this point in time. She is not quite on yet. We will know when she's on, but she had asked if she could have a few minutes to get on.
Okay. So why don't we take a break right now for 15 minutes and we'll come back at 10:28. items 5B and 5C. Is Tammy Moss Chandler, Director of Health and Human Services, on the line?
Yes, thank you very much. Good morning, Supervisor Haschak, members of the board. Thank you for your patience with my technical challenges this morning. I'm pleased to be with Dr. Janine Miller to bring these two important items to you today. And I want to thank you for your time to hear these important items in the midst of a very busy schedule with the current pandemic and COVID-19. These items are timely and before you today for a new pilot that will begin July 1st upon your approval of these agreements, which have actually been in process for over 4 years. Already when I arrived to Mendocino County 4 years ago, there were efforts underway in Mendocino County for this important new pilot, which is tied to the Medi-Cal 2020 waiver that was approved by the federal government for the state of California under the Department of Healthcare Services Medicaid waiver process. And so in 2015, the new 5-year waiver was approved. It has many different special Medi-Cal options in that waiver between the state and federal government with the Centers of Medicaid and Medicare. You'll be familiar with some of those. For instance, the Whole Person Care pilot that we've participated in over the last 3.5 years is a Medi-Cal pilot program under that waiver. And there's several others, like a conversion and change to the California Children's Services Program. So there's several programs that we have participated in this waiver, but it's been very challenging for us to overcome the barriers to this particular pilot program that's before you today. It's called the Organized Delivery System for Drug Medi-Cal Expansion in the state of California. And it offered an opportunity to California counties to opt into a pilot that would expand the network of services for Medi-Cal eligible individuals to receive substance use treatment services that have not been available to the Medi-Cal population over the last 30 years or more. These services actually include things like residential treatment for substance use disorder, meeting medical criteria for that, and expansion of several other services that right now are only offered to a very few Medi-Cal eligible people in California. It's been particularly challenging and a long process because the only counties that were able to ramp and adjust to these very rigorous infrastructure and network development requirements under this particular pilot project were large counties that already had a number of private services in the area to meet the new requirements. And there have been no rural counties that have participated in the pilot to date. So over the last 4 years, we've worked with our neighboring rural counties and our Medi-Cal Managed Care Plan, Partnership Health Plan of California, along with the Department of Healthcare Services and the federal government, to create a rural model to pilot this work in rural California. So I'm extremely proud today to bring you these agreements. They're large agreements. They recognize the complexities of this multi-governmental partnership that is a partnership between the federal Centers for Medicaid and Medicare, the state Department of Healthcare Services, Partnership Health Plan of California as our Medi-Cal Managed Care Plan, and the county's role as a county plan for drug Medi-Cal services, which historically, again, have been a very limited number of services, predominantly outpatient services only. So I'm pleased to have Dr. Miller here with me today. She's been part of a technical assistance advisory group with those other rural California counties in Partnership Health Plan over the last 2 years. Over the last 9 months, she's met every other week with the State Department of Healthcare Services team, Partnership Health Plan, and our Behavioral Health and Recovery Services team to work through the details. I want to thank actually Deputy County Counsel Charlotte Scott for working alongside Janine, and the support of Christian Curtis in that work to really work through these levels of agreement that allow us to implement this pilot. And I think with that, I'll pause and see if there's any questions that the Board of Supervisors has for me or Dr. Miller at this point.
I have a question.
Yes, Supervisor Williams.
So It looks like there's a difference of about $266,000 between the DHCS contract and the total for partnership. Does that represent the county's contribution?
Thank you. Thank you for that question, Supervisor Williams. It actually represents, there's a county contribution for the entire effort that actually recognizes our historical rate of revenue for our outpatient services and the services we provided. And really the design of this is to leverage every available local dollar to pull in additional federal and state reimbursement rates to do this expanded network. That $266,000 that you see is over 3 years. And it is correct that it actually is what we would contribute for administrative costs. So just over $70,000 a year to help administer this. It will be a new process administratively for our billing team and our administration, because in addition to the state processes and reporting processes and administration we've done historically, we have to do an additional layer of work alongside Partnership Health Plan in order to secure those additional federal and state reimbursement opportunities. So what you see there in that difference, that delta of about $266,000, is specifically the cost set aside for administration.
And is that sourced from general fund or realignment, or this is a new expense, or is it just being reallocated from an existing category?
Thank you for that question. It's just being reallocated from an existing category. There's no discretionary general fund in substance use treatment services in Mendocino County. There's a very, very small maintenance of effort that's been required. There's a little bit of realignment, which we're looking at very closely, of course, in the current larger fiscal arena, but we're confident in that. And then there's a large, the predominant funding is federal money that comes through the state that we'll apply for again in July of this year. So we are using existing allocations, existing fiscal resources, and just reallocating them to this new partnership. We do know we'll have to track those federal and state funding sources closely. Given the current budget climates at the federal and state level, but at this point we don't have any imminent cuts in those areas that would prevent us from recommending to your board and for us to move forward.
And finally, while I support this, I think it's a great idea, and I really appreciate the effort staff has put into trying to clarify. I think just like with RQMC, we should be asking about performance metrics. A couple years out, how do we look back and determine whether it was a success for the county? Do you have any thoughts on how we're going to track this contract? I understand we probably don't have much bargaining ability given that Mendocino County versus the partnership program, but it would be great to have metrics in place so we know if we're successful.
Thank you. Through the chair, if I might, I appreciate that question as well, because this is actually extremely different arrangement than we have for RQMC. We're not contracting out our services from the local level to local vendors. We're actually in a government entity to government entity partnership to not to overuse that word, since Partnership Health Plan of California is also the name of partnership, but we're actually in a government entity, Medi-Cal plan to Medi-Cal plan. So Partnership Health Plan is a Medi-Cal plan. We're contracting with them to help us expand a network across a whole region that they oversee, because we're only a county. So it actually gives us access to their entire region of network and resources in order to serve Mendocino County clients. It allows our local providers to be part of that expanded network and serve a greater number of people and expand their services. And there's been a tremendous amount of investment by Partnership Health Plan already to provide local grants, for example, to Ford Street in our county, and to many other substance use treatment providers throughout their entire Northern California region in order to expand to get ready for expanded network requirements under this. To your question about performance measures, actually, we'll have very specific performance measures under this pilot project with the state and federal government, as well as alongside Partnership Health Plan. And we've already established quarterly performance meetings, both to help assure that our employees and our system locally is getting all the services and expansion that we're expecting out of this. And I'm happy also to bring those quarterly reports to this board. There's a tremendous amount of quality assurance built into this government-to-government partnership arrangement.
Thank you. I support it.
Supervisor Brown. Supervisor Brown, do you have any questions? She's muted. Okay, we'll go to Supervisor McCowan.
I just got unmuted by staff.
Okay, very good. Supervisor Brown.
Thank you. Within the agenda summary on the regional model, it listed the counties, including ours. What about Sonoma and Napa? Were they a part of the Bay Area grouping that you mentioned? And then I also would like to ask, why isn't Lake County in the model? What are they doing? And I have more questions.
Thank you. If I may, through the chair, Supervisor Brown, thank you for those questions. So to your first question, the other counties have the ability to opt in. And so Sonoma County and other larger counties, I'd have to go back and look if not Napa opted in. There certainly are counties that did not opt in to try this pilot. And but there is no other regional model for this. This is the first of its kind to have a regional model. I can assure you that Sonoma County, once they saw that Partnership Health Plan was working with their rural counties to pilot a model, there was interest expressed through those larger counties, but they had already opted in as large, more urban counties into the pilot directly with the state. So this is the first of its kind, a regional model like this, again, focusing specifically on the rural nature. To your question about Lake County, they were invited by Partnership Health Plan. They are a Partnership Health Plan county. And at some point, they chose not to opt into this. So for them, that means they do not have expanded services for their Medi-Cal residents. They will not have these expanded residential treatment services to pilot for Medi-Cal. And they have missed the window to participate in this pilot program at this point. So we have this opportunity to opt in to be part of this pilot. Again, there's only about 2.5 years left in the current waiver process to really test out this pilot and then work with the state and federal government as well as Partnership Health Plan around what this might look like for the future of drug Medi-Cal treatment services. There's been a lot of work before COVID-19 at the state and federal level to see what might be expanded in the future for non-pilot counties as well. But this is our opportunity to get in earlier and really test out an expanded delivery service system with Partnership Health Plan taking the tremendous amount of the risk on behalf of the county for that.
Thank you. And going to Supervisor Williams, talking about cost of the contract, is this an estimate or is it an exact amount?
Thank you for that question. This is actually the exact amount committed right now with the expectation inside of the contract for a regular reconciliation process. You know, for health plan models, it's based on, what are called actuarial analysis. And in this case, which are based on actual medical bills and billing. And because these are expanded services that have not existed, there's a lot of estimating done in the bigger model with the state and federal government. So that's a really important reason why we've built in the ability to be able to both renegotiate, so to lower the cost, and partnerships built into place to consider increasing the cost. And we both have the option to be able to walk away from this pilot and return back to normal if the costs don't come in as the estimate. But right now, these are the fixed maximum costs in the agreement with an annual reconciliation and review of actuarials. And that's why there's going to be such rigorous performance monitoring and review of this pilot project, because it's the first of its kind and we'll be learning a lot. So back to Supervisor Williams' questions about performance measures, it ties to both the fiscal tracking of this as well as the performance measures of outcomes and service delivery.
Okay, the contract goes to 2023. However, and you touched on it a bit, if we want to leave the model, I did not see an exit clause within the contract.
Thank you for that question, if I might, through the chair. There's actually a very strong section in both agreements, and I would have to take a break. I know it's section 8 of one of the agreements. I'd have to take a break to look at the other agreement, but I want to assure you that's something that we look closely, Supervisor Brown, with County Council, and we are. There's a strong exit termination without cause. So there's a termination provision for the county that exists and is recognized.
Thank you. And then for case management, will this new system work without putting a strain on our county mental health system?
Well, I would ask for just maybe a little bit of clarification of what you're thinking in terms of strain on the mental health system. In fact, these are specific to substance use treatment services. We know there's a group of individuals who have co-occurring disorder across mental health and substance use treatment. We actually believe this will relieve some stressors in the system itself for individuals who have had difficulty getting access to the kind of comprehensive treatment that they could benefit from a substance use disorder treatment aspect. So certainly we know for our employees, there's going to be new things to learn in terms of billing and administration. But overall, for the system of care, we expect that this actually will benefit the system of care by expanding the available services to the individuals.
Thank you. And it appears the county will provide or offer space within the county building to Partnership Health Plan. Will the nonprofit then be paying us rent? I'm sorry, through the chair, I'm not sure exactly where you're referencing, Supervisor Brown. Maybe Dr. Miller did answer that question. If there's a sharing of space recognized in the agreement itself. Well, it described, I can't remember if it was an agenda summary or whether it was a contract itself, that there would be office space provided within a county facility for Partnership Health Plan, but maybe I read it wrong. So I will go on to the next final question I have. What happens when CalAIM kicks in?
So thank you for that. CalAIM is actually the next the next version of the Department of Healthcare Services 1115 waiver, which this is in the Medi-Cal 2020 1115 waiver. And so CalAIM now has been deferred for over a year, and there's been a work group specifically looking at what would be the transition of various pilot projects. They're in the Medi-Cal 2020 waiver to the new waiver, which is called CalAIM. It's actually been called a couple of different things, but Supervisor Brown is aware that's been what the statewide name has been for that new waiver development. So there's been multiple work groups on that waiver development. Because of COVID-19, those work groups have been put on hold until sometime next year. We actually have been participating regularly in those CalAIM work groups at multiple levels, from CEO Angelo's level to Dr. Miller's State Association and others. So we don't know yet what the details will be under the next waiver, and that will be big part of the opportunity to be in this pilot is that we will be a pilot project evaluating what's working well and not for us locally to be able to better inform the next waiver under CalAIM.
Thank you, and that's all, Mr. Chair.
All right. Thank you. Supervisor McCowan.
Raise and more. Oh, thank you, Mr. Chair. Supervisor Brown covered the points that I had intended to raise and more, so I have no further questions, and I do support the item.
All right. I had a couple questions about the distribution of services, and certainly this program is much needed throughout our county. And so how are some of the services going to be provided throughout the far reaches of our county?
Thank you, Supervisor Haschek. I think one thing that was very challenging for rural communities is that provider network capacity. And so in our far reaches of our county, we actually have the opportunity to consider placement for especially residential treatment in some of the neighboring counties that actually might be closer to someone's home and then coming all the way to Ukiah or to Lakeport or other places if you live inland. We did not provide the full, we could actually follow up and provide your board with more information about where all of the currently identified contracted services providers are through Partnership Health Plan. Certainly our employees are a part of the outpatient capacity during this, and we expect that our services will be really utilized in our coastal offices for outpatient, and certainly in our Willits office potentially, as well as in Ukiah, and then that there are nonprofit providers locally already in contract with Partnership Health Plan to provide services for residential, including Redwood Community Services and Ford Street. But I'm sorry I don't have all of the places, but like many things with especially substance use treatment services, on a case-by-case basis, sometimes it's more valuable for someone to be placed outside of their community than inside where they have their connections to their substance use challenges. So there'll be the opportunity to really look at placement for residential and an opportunity to keep looking at the full utilization and needs to expand services further. I'm not sure if I answered your question fully, but.
No, I think I get the idea about it. And the other was about the staffing. And there was, I'm certainly happy that you've been in communication and conferring with SEIU 1021 about the staffing needs and how that might look in this new model. So I appreciate that. If you have any comments about that.
Thank you. It really is important in this very new kind of pilot where we are part of a system instead of and not the only central part of the system, for our employees to be supported and have what they need to really work in this new partnering model. And so we actually have not only Dr. Miller sent me a note clarifying that there's a monthly quality assurance meeting with Partnership Health Plan employees and Dr. Miller's employees around quality assurance and monitoring the implementation of this pilot. But we've also committed with our SEIU employees and our management team and substance use treatment services to meet regularly with them to really make sure that this implementation is going smoothly and really supporting the important work of our employees in this new system or expanded system. It's actually expanding our existing system.
Yes. So thank you. And Supervisor Jurdy.
Yeah, I had a similar question about how the services will be rolled out. My understanding is that Partnership Health for behavioral health or mental health services has a number of contracts in our county with, say, the clinics and with just individual providers. Do you know if they're going to be using any services through the clinics? They're people who they already have contracts with.
Thank you for that. That's actually an excellent question, Supervisor Jarity, because there's definitely coordination with the important medically assisted treatment services for substance use disorder that our clinics already partner with us in terms of certain aspects of the system that they already support for outpatient services and outpatient medically assisted treatment. There's actually a very challenging carve out for community health centers under federal statutes. And there's been a long effort in California, and particularly through this pilot, to try to expand the capabilities of our clinics to provide some of the new services in this pilot. And many of those services are prohibited. So the clinics are partnering alongside this as part of the network for certain services, but there are actually particular services under this that Partnership Health Plan has had to develop with a new network of providers that the clinics were not able to provide under the federal rules of what's carved in and out of their service provisions. Unfortunately, like many government programs, Medi-Cal is amazingly complicated in what's carved in and out of different specialty systems and for different providers. And while this waiver has allowed us to really pilot an expansion of a lot of those carve-outs, with our clinics, it hasn't allowed us to, they can't be a contractor for everything. But I do want to assure you, we've worked really closely with ARCH and the clinics. We have a really robust partnership across behavioral health for both mental health services and substance use treatment services. And so they will be part of our coordinated check-in with partnership about how we're coordinating services across the clinics, the new service providers for some of the new, particularly residential and expanded services and the county.
Thanks.
All right. So going to public comment. Let's see. We didn't get any call-ins about the public comment. I did get an email from Ford Street Foundation commenting about this, but I don't see any other comments posted on the website. So we'll go back to the board for a motion on either 5B, 5C, or both.
I would move the recommended action on 5B and 5C.
Okay. Do we have a second?
I'll second the motion.
All right. Any further comment? Okay. Deputy Clerk of the Board, could you conduct a roll call vote?
Of course. Supervisor McCowan?
Yes.
Supervisor Jarity?
Yes.
Supervisor Williams?
Yes.
Chair Haschak?
Yes.
And Supervisor Brown?
Yes.
The motion carries unanimously.
All right. We're moving on.
Mr. Chair, I would just like to comment briefly that, as mentioned, this has been in process for 4 years. It's been a tremendous amount of work by all of our staff, and hopefully this will result in getting the needed treatment for a lot of people who desperately need it, and they'll be able to get it here in our own county. So I really want to acknowledge all of the work that staff has put forth to bring us to this point. Thank you.
Agreed. Okay, agenda item 5K, which is discussion and possible action regarding an update to the Board of Supervisors from the Mental Health Treatment Act Citizens Oversight Committee on progress since the February 4th, 2020 update. And the sponsor is the Mental Health Treatment Act Citizens Oversight Committee. So is Allison Bailey doing this report?
Yes, and she's almost in the room. Just a moment. We have Janine Miller from Behavioral Health Recovery Services on the line to speak to this item.
Okay, very good. Dr. Miller?
Good morning. And I was hoping Allison was going to be able to join us. And do we know if she's not able to get in, Lindsay, or?
She was on the line and lost connection, and we're trying to get her back.
Okay, because I think she had most of the update.
Okay, is it something that we should skip for right now then?
If we could do that, that would be great.
Okay, so 5L is also pertains to the Measure B funds and budget. So we should probably skip that too. So maybe we'll go down to item 5D, which is the Chief Executive Officer's report.
Chair Hashjack, there is no CEO report today. I would ask that you go to 5E, please.
Okay. And item 5E is the discussion and possible action, including review, adoption, amendment, consideration, or ratification of legislation pursuant to the adopted legislative platform. Is there any report on that?
Chair Hashjack, there is a report. Deputy CEO Sarah Duquette should be on the line any minute now. I guess we're batting 1,000 here. Let's see.
Well, I do have a comment, Mr. Chair, while we're waiting.
Yes, Supervisor Brown?
Thank you. CSAC and 10 county affiliate organizations have requested state assistance to support the 1991 and 2011 realignment and the critical county public health, human services, behavior health, and public safety services administered by counties on the state's behalf. And they're urging all counties grappling with the steep declines in realignment funding to communicate those impacts to the governor as well as our senator and assembly member. So I think this has to be a part of action now, since the budget is being considered at a state level. I think it's very important that we do this.
Okay. And CEO Angelo, is that on your radar? And
yes, Chair Hashjack, but I would like to thank Supervisor Brown for bringing that up. And Lindsay, is Deputy CEO Duquette on yet?
Yes, she is.
Oh, great. Okay. So, Chair Hashjack, if you would like to go to 5E, she is on?
She is not on. She's working to get on. I apologize for the confusion.
Well, we do have, it looks like we have Miss Bailey back on. Is she, am I looking at that? Is she on?
you're cutting out a little bit. Who'd you say was back on?
Okay, Deputy CEO Sarah Duquette is on. If you would like to go to the ledge report, Chair Hashjack.
Okay. Yes. Deputy CEO Sarah Duquette.
Good morning, Chair, Board of Supervisors, and Supervisor Brown. I am going to talk about that letter that CSAC is requesting at the end of my presentation. So I wish I was here with better news, but the governor did the May revise last week. And this year, the May revise comes amid a worldwide pandemic and a fiscal situation that saw a state, at one point, a state surplus of $5.6 million, and then now is projected $54.3 billion deficit in just a 4-month span. The May revise reflects a strategy to balance the budget by canceling previously proposed expenditures, utilizing loans, federal funds, reserves, and other new revenue sources to close this estimated deficit. The strategy also includes trigger cuts, which total $14 billion that will not be implemented if certain federal funding is granted to the state. So that's linked with a recent proposal by Congresswoman Nancy Pelosi for a stimulus package. It seems unlikely that the package as is will go anywhere, as the Senate does not seem interested in pursuing everything that's in that stimulus package. So I would say to expect that many of those trigger cuts will go into effect, because it's probably unlikely we're going to get all $14 billion from the feds. I'm going to go over a couple key highlights. One, the May revise provides the release of the Federal Coronavirus Aid, Relief, and Economic Security Act monies to counties and cities. It does include a schedule for counties under 500,000 in population, but the dollar amount is fairly low. I think for Mendocino it was around $9,000. The May revise eliminates the State Division of Juvenile Justice and assumes that all future youth offenders be detained and rehabilitated at the local level. So that's a service that the locals will have to provide. He did keep his one-time $50 million investments for PSPS action, including $30 million to the Public Utility Commission to improve review of the PSPS plans and PSPS reports, and assistance to local government. So that's good news. The May revise does eliminate most of the funding for CalWorks subsidized employment, which helps small businesses hire recently unemployed individuals. A little bit on the government finance and administration side, the May revise includes several provisions designed to combat the budget's deficit by raising revenues and stimulating economic growth, like tax exemptions, tax credits, and some new taxes like e-cigarettes. In total, the provisions are expected to net $4.4 billion in 2020-2021 budget year. Due to the COVID-19 recession, taxable sales are expected to decline by 4.6% this current fiscal year, 2019-20, and further by 17.3% in 2020-2021. The administration estimates consumer spending to decline by 15.6%, which is a substantial decrease, even when compared to the Great Recession, when consumer spending declined by only 8.9%. The governor's January budget also originally projected that the growth for property tax was going to be 6.4%. That has been reduced to 5.8% for this current fiscal year. And for next fiscal year, they only expect 3.5% growth for property tax. Moving on to the Administration of Justice, the Community Corrections Subaccount, also known as 8109, the 2019-20, this current year's estimated revenue is down to $1.152 billion, which does not fulfill the statewide base amount, which is 1.366. Consequently, there will be no growth for 2019-20. And this is really compared to January's budget, which said there was going to be 92.6 million more. For 2020-2021, the projections are down to 1.174 billion. Again, does not meet the statewide base amount and will be short. So no growth is expected there. For natural resources and environment, with the ever-present threat of catastrophic wildfire, the governor's proposal does expand investments in CAL FIRE, OES, and local agencies for preparing for wildfires. Cap and trade is an interesting one. The May revise does not change the allocations in the January budget. However, it acknowledges that there's significant uncertainty surrounding the cap and trade proceeds that will be generated at upcoming auctions. So they put in a new pay-as-you-go budget mechanism that would authorize Budget Act expenditures based on the actual proceeds authorized at each quarterly auction. For homelessness, back in January, the governor came out with a $750 million plan, and that plan included quite a bit of money to cities and counties. That plan has been replaced with an equal amount of Federal CARES Act funding, and that new proposal directs the use of these funds to purchase hotels and motels secured through Project Roomkey. And Project Roomkey is a multi-state agency and local partnership to provide safe isolation motel rooms for vulnerable individuals experiencing homelessness. Transportation, local transportation dollars from the taxes. As a result of the statewide shelter-in-place order in response to COVID-19, fuel consumption has decreased significantly. Based on revenue estimates from the Department of Finance, CSAC estimates a 129 million reduction in the county formula transportation revenues for the current fiscal year, and a reduction of 116 million for next fiscal year. Education, the K-12 system, the CSUs, UCs, and community college were hit significantly and will have deep cuts. The governor is using revenues and other streams to lessen that burden, but there is one area that does directly impact Mendocino County. So in January, they were proposing to give $3.6 million to University of California Division of Agricultural and Natural Resources. We know it as UCCE, or the Cooperative Extension. Well, that proposal has been revoked, so that's not going to happen. And in addition, that the UCCE will be receiving a 10% reduction. So that will affect services out of that department. Moving on to Health and Human Services, the governor's May revise updates revenue assumptions for 1991 and 2011 realignment. Due to the impacts of COVID-19, sales and use tax revenues is expected to sharply decline and reduce realignment funding. The drop in overall realignment revenues and eradication of growth funding has significant implications for social services provided by counties, especially for child welfare, adult protective services, and extended foster care, as counties will need to continue to meet the entitlements in the MOE obligations. Like Supervisor Carrie Brown mentioned, CSAC is urging counties that are grappling with these steep declines in realignment funding to communicate this impact to the governor and to our representatives in the legislature. And so as I'm here giving you this update, I also recommend that the board provide direction to staff to move forward with mirroring the letter that CSAC and the affiliate organization sent, asking the state to stabilize realignment funding by backfilling for lost base revenue in both the current fiscal year and next year's 2020-2021 budget. And that's a lot of information. We have a couple larger documents if you want details, but that's a general overview. Not really great news at the state level with the declining revenues and the governor attempting to close the $54 billion deficit.
All right. Thank you, Ms. Duquette. So any comments about that? Supervisor Brown, any further?
Well, I believe this board, we need to give direction to staff instead of waiting for action at a board meeting to get these letters written as they apply to the state budget and whatever may be happening at a federal level. This is key to our survival financially.
Yes. Okay. And Supervisor McCowan.
Thank you, Mr. Chair. I agree with Supervisor Brown.
Okay. And so do I. And Supervisor Jurdy.
I'm just hoping that the different departments can submit to the board, maybe in a CEO report, just how does this translate into the county budget? So when there's cuts for transportation statewide, what does that equal and translate into for Mendocino County transportation, et cetera?
And Supervisor Williams.
No comment.
Okay. And just another question for Ms. Duquette is, so that SB1 money will result in the loss of 129 million and 160 million overall in the state. And so our part would be, significantly reduced.
With the decline in the tax revenue, we will see a decline for those years as well.
Right. It seems like the only bright spot is that CAL FIRE and their work is not getting cut. So, okay, so do we have direction to write that letter? It seems we do. Okay. Deputy CEO Duquette, are you all right with that? Very good. All right. Thank you for your report.
You're welcome.
Moving on or back to agenda item 5K that was introduced about the Measure B. Okay, is Allison Bailey on the line? No, this is...
I am. Sorry, I booted myself out of the meeting the last time you called for me. I apologize.
Okay, it's agenda item 5K that we're back to. All right, Ms. Bailey, go ahead.
Yes, I'm here, and let's see. So for Measure B, we'll start with fiscal. So far, the life to date is 16,038,072. expenses, as far as line items go, are still fairly low, but we are working on a budget that accounts for funds that are already dedicated, including the architect and things that we know that we're already going to spend. So that will be more accurate. I'm hoping to have that by June. It may be July because it's end of year and a complicated year for everybody. Let's see. We also have a report on the training center committee that was just doing capital. All of the building and facilities things have also taken on quite a bit. They've decided to help with the business plan and do some outreach and ask for different sorts of trainings that people might want to perform there, and get an actual schedule going for that. Though that's probably not going to be until the fall, considering. See, for the CRT, we're well into phase 2. Recently, the CRT team, including facilities and behavioral health, have worked on going through a virtual model and choosing some of the hardware and also just the aesthetics of the building. So that's been fun, and that's about all I have. Janine definitely has some information that she would like to share as well if she's on the call.
Okay, Dr. Miller.
Good afternoon, Dr. Miller. So just wanted to give a brief update. We have some items that the committee did approve that we don't have on your agenda today, obviously, but we do have them coming forward on June 9th and I believe June 23rd, if I have that date right. So we will be looking to present those to you guys then, and that is just a quick look at purchasing some equipment through behavioral health for the training center, and then a prudent reserve that the committee voted on will be coming forward for you in the next month. And I think that's what I would give an update on some things we worked on in the committee.
All right. So I'm going to go to board comments and see Supervisor McCowan.
Thank you, Mr. Chair. I have no comment. Appreciate the report.
Okay. I had a couple questions. When is the next Measure B meeting?
It is May 27th, which is a Wednesday.
Okay, and that's online, of course. And then with the CRT, you said it's in phase 2. And what does phase 2 entail?
Phase 2 is kind of that liminal portion between making sure that we're through the part of being allowed to prepare the land and use the land and all of that, and getting ready to actually develop and start construction. In fact, I should have mentioned that. Facilities has already put out the RFI for a construction manager. So fairly soon we will have some bids in from them, and we'll know who we'll be working with on the construction phase.
Okay, thank you. Supervisor Jurdy.
I have no questions.
Okay, and Supervisor Williams.
Yeah, so I don't think, I've said this before, I don't think Measure B raises enough money to pay for what we've promised to provide. And I think we need to do a financial analysis. We need even a cursory one-page financial analysis that describes how we plan to operate the facilities we're building. And it should be done before we break ground, before we have permits, before we pay for architectural drawings. Otherwise, we're going to surprise the public that we've started down this route and we don't have the money to pull it off. I'm not sure how to push that forward. I mean, we passed an item previously to do a financial analysis. I think the sheriff called it putting a business plan together. We still need to do that exercise, and I'm not blaming staff. I'm suggesting that this board has the responsibility to make sure that we can meet the commitments of Measure B. Any thoughts?
Yes, yeah, that's actually been my main concern outside of just making sure that the needs are met and the projects are okay, and for the committee. But yes, and I have a plan to put together complete budgets for the existing projects, and that way we will just have this open space, and we will be able to determine how much that open space, that open I guess unreserved funds are going to be used or not used, but I guess how much they could be used for. And I have also started a conversation with Adventist Health and looking for guidance on how to start a PUF or an inpatient unit independently without them. And we'll take a look at all of these different angles and then see what we have. But I think that you are absolutely right, that we have got to put this foundation under us before we can really make these final decisions.
Well, I certainly appreciate that you're carrying it forward, and my comments are no reflection of staff at all. It sounds like you're getting us closer to a realistic snapshot, which will let us have an open discussion about the compromise. If we can't do it all, where do we want? What is the public support? What should we be building? So yes. I thank you, but I guess I'd appreciate to hear other board comments on the overall concern of not having enough money from the Measure B to provide the services that we've been talking about.
Well, I think your comments are very well taken, Supervisor Williams, and especially with this depression that we're going into. And we already had concerns about not having enough money to run the aspiration of the mental health treatment facilities that we talked about, and now we're talking about less money than that, and how do we pull it off? And so the sooner we can get a grasp on that, the better off we'll be before we start heading down roads that aren't going to lead us to anything. So
I do have a follow-up question to that. 'Cause we've all expressed concerns about this from before Measure B even existed as a ballot measure. Allison, are you getting access to financial projections for future sales tax dollars? I think all of us are receiving information from different sources about the economic recovery, how fast it will be, how fast is it likely to be, and how slow might it be. And maybe we should be sending some of that to you, because I'm not sure what you're seeing, because there's certainly lots of scenarios out there, some of which show, I would say, about a 20% reduction in sales tax for this coming fiscal year over what the county would have received, and certainly projections showing that the recovery could be pretty slow for at least the next 5 years. And so I don't know what you're getting in terms of projections, but I'd be happy to forward to you some of the information I'm getting.
That would be great. More information is always good. So I have been working closely with Lloyd. He's been incredibly helpful. Lloyd Weir in the auditor's office. And I have read myself, and it looks like 20%, and then it could end up being 35% in year 3 of this recession. So I don't know, but I'm trying to be very conservative with my numbers.
Okay, and Supervisor Brown.
No questions, thank you.
All right. Is there, let's see, no public comment was received on this item, and we have no one calling in. So is there any motion or action needed from the board? Hearing none, we thank you for your report, and you'll stay on the line for agenda item 5L.
Okay, sounds good. Thank you very much.
So moving on to agenda item 5L, discussion and possible action, including adoption of resolution amending the position allocation table as follows. Budget unit 4052, add 1.0 FTE department analyst 2 and 0.25 FTE staff assistant 2. As administrative cleanup, move 1.0 FTE administrative project manager measure B from budget unit 1020 to budget unit 4052. And the sponsor is Human Resources.
Excuse me, Chair Hashtag. If I could please remind everyone on the line to please mute themselves unless they're speaking. Thank you.
All right, thank you. So the manager of Human Resources, Director William Schertz, you're the sponsor of this?
This is Johnny Cranmer, HR Manager. I'm here to discuss the item.
Okay, very well. Go ahead.
Thank you. Good morning, Chair Haschak and Supervisors. This item is to, as you stated, to add 1 FTE Department Analyst 2 and a 0.25 Staff Assistant 2 for the Measure B. This item partially comes about by an the Oversight Committee's recommendation on February 26, 2020 to bring to the board a recommendation of the hiring of support staff for the Measure B project manager. The department analyst will serve as a team leader or liaison concerning internal and third-party efforts during the creation or renovation of facilities, and is funded by Measure B. The analyst will collect and interpret data concerning mental health, homelessness, special medical ailments, and substance use in order to determine connections and how these people are being met or underserved in Mendocino County. The analyst will will be able to help the project manager with important tasks such as billing and other essential duties. The class spec for department analyst was provided upon request to potentially address questions about the use of the department analyst to perform this work. The part-time staff assistant, 0.25, will primarily support the committee, meetings, agendas, tracking, and preparing recommendations, event coordination, and possibly other tasks. The item to move the project manager Measure B from its current budget unit of 1020, where it was placed when it was first created, to budget unit 4052. There are no additional costs involved as a result of this move. The other costs are funded by budget unit 4052 Measure B. And I am available for questions, as is Dr. Janine Miller and Allison Bailey. Thank you.
All right, we'll start off with Supervisor Jurdy.
I don't have any questions.
Okay, Supervisor Williams.
No.
Supervisor Brown.
No questions.
Okay, Supervisor McCowan. Supervisor McCowan.
Thank you, Mr. Chair. No.
Okay, I guess my question is that we have the architectural firm doing feasibility studies and everything, and we have this project manager, and we're hiring the construction manager. And so I guess I'm concerned about the duties of the analyst being a full-time position, and the total cost of $135,000, I think. And if we're in real need of that in this time when we've just been talking about the loss of income for Measure B, and it's just very concerning to commit to this kind of position when, well, I'd just like to hear what the specific duties are that this person will do that the others can't.
So Chair Hashcheck, Dr. Janine Miller, Behavioral Health Director. And so what I would like to talk a little bit on this department analyst. So as we looked at these positions and the support that Allison needs to be able to do her job, she's currently with the support of myself and some of them, I'm having to actually pull behavioral health staff to support Measure B. As you know, the CEO's office had to do the same and the sheriff's office did. And one of the things we've noticed in this process is not only does she need the staff assistant support, but she also needs someone to help her be able to pull and do some of the budget stuff that's required through Measure B, work with the auditor's office when she can't. Currently, she's having to use behavioral health financials department when she needs some of the different things that she needs that an analyst would look at. Some of the feasibility that Supervisor William was talking about, Allison and I have been talking about putting that together. And having that position would allow Allison to have some additional support to be able to have someone help her go through all of this and have things more timely. Right now, she's dependent on behavioral health staff having some time available to assist her as we can. And of course, that comes out of the behavioral health budget. And as you know, we are taking cuts there due to COVID ourselves. So part of the hope is that the department analyst, and I'm not saying that we're asking for a full-time, my thought is that this may actually be something that gets split with behavioral health, that if we don't need it full-time, that this person could split their hours between doing behavioral health work and Measure B work. We just don't know. We know that right now Allison needs a lot of support, and that's the same with the 0.25 staff assistant. We would be pulling a 0.25 out of behavioral health, and 0.75% of their time would be doing behavioral health work, 0.25 would be doing staff assistant work and supporting Allison with all her duties. So we'd be looking at the department analyst and seeing, does she need a full-time? And if she doesn't, then we could have some of that be paid for and support to behavioral health.
Thank you for that explanation, especially with the downturn in the economy and everything. I could support a half-time analyst and see where it goes, and the 0.25 staff assistant. So
I have a question.
Yes, Supervisor Williams.
Will filling this position get us a business plan?
My hope is yes. I believe that by giving Allison this support, these people will also be able to work with behavioral health and other community members, which is going to be able to get us our business plan and our feasibility study quicker.
All right. Everyone's had a chance to speak about this issue. Let's see, I don't see any public comments. And so back to the board. Anyone want to make a motion, action?
I'll move the recommended action.
Okay, is there a second to that?
I could support it with if we could augment it.
How's that, Supervisor Williams?
Well, if we could augment it to agree no spending until we have a business plan, I could support hiring as a full FTE.
What do you mean by that?
Well, that we've been piecemeal spending Measure B dollars. I want a business plan before we continue spending, so that we don't get in a predicament where we have some land, we have some drawings, we think we can construct a building, but we can't staff it. I'd like a business plan that talks about the construction cost and the operations, and then consider it shovel ready and move forward. If we could tie that in, I think it makes sense to fill this position so that we can get the business plan complete. I just don't want to keep sort of nickel and diming Measure B until there's nothing left and we have nothing to show.
Mr. Chair, if I could ask for clarification on that.
Yes, go ahead.
I heard the proposed modification was for no spending, but does that exempt the position that is potentially being created?
No.
So I guess the question is, how do you fund the position if you can't spend for it?
We fund the position with the target of producing a business plan before we continue spending. What we don't want to do is, decide we're building 3 buildings, not knowing if we can hire staff to operate. I mean, who in business does this? You build a grocery store that you don't think you can operate once built. It doesn't happen. It shouldn't happen. And here we are talking about multiple facilities. When I look at the CRT and see Sonoma County, I think it's 45 cents on the dollar reimbursement, and a CRT may cost $800,000. And we have $1.8 million. You start putting it together and the numbers just don't work, not even close. So I think we need to do that financial analysis. If filling this position gets us there so that we can have an honest discussion about how to move forward and what compromises we're willing to make, I'm fully behind it. I just want to be careful that we don't keep moving in the direction of facilities without that plan of operations.
Okay, Supervisor Brown, are you all right with that amendment?
As long as County Council is.
County Council.
I'll confess, Mr. Chair, I'm still a little bit confused. It sounds like the position would be created to do the work, but that the position could not be filled until the work was done. And I think I'm missing something. I don't quite understand.
Yeah, Christian, how would you like to word it so that we fill this position today and then we halt additional spending until the business plan is produced and approved?
And I think it would be sufficient to simply indicate that this would be approval of creation of the position, but that additional spending above and beyond the position would be halted, or an indication that the board intended not to approve any additional spending until such time as a business plan was approved.
Agreed.
Supervisor Brown, is that clear?
Yes, I do have a concern for processes already going forward when we say no more funding or no more recommendations coming to the board until a business plan is done. I'd like to hear how long it takes to write a business plan and what is in the queue so far that we've already committed to, that we need to go forward with.
Okay, back to Dr. Miller or Program Director Bailey.
Hi, yes, regarding how long it will take to write a business plan, I'm thinking at the very latest, it will be finished by July, and only then because it's the end of the year and there's a lot of things going on. So as far as my getting access to all of the numbers that I may need, it might take just a little longer. But Nocton Lewis, our architect, they have all the numbers that they need in order to tell us, or at least give us an idea of how much the CRT will be completely. I have the final approved budget, hopefully approved, or hopefully final rather, for the training center. We're working off of the funds that the Board of Supervisors gave us a while ago, and it should be enough, if not more, than what we were thinking, depending on what's going on with the septic. So we are not at all far away from having both of the existing projects outlined, and that will be a large portion of it.
Well, going on with that questioning is that my understanding is the CRT needs to be done or have the ground broken by November. Yes, that's true. We're working with the CHAFA for, I believe it is 500,000, but Janine can speak to that better than I can. She's been working on it the whole time. So if we waited on this business plan to continue work on it, because no one's going to work without money, then will that put it into jeopardy about the November date?
Almost certainly. If we completely stopped funding or paying the people who are working on that property, then that would become an issue probably as soon as August.
Chair?
Yes, Supervisor Williams.
Yeah. I don't want to jeopardize that project and have to give $500,000 back to the state. But what if we continue with it and we find that as a result, we can't afford a PUF? What do we tell the public? The public will ask, why did you build this out of sequence and run out of money? Why didn't you prioritize? I think they would be pointing at our lack of business plan. I don't know what to do with the situation. I want to support staff. I think they need this resource in order to continue moving forward. Otherwise, Measure B dollars are being inflated away. That doesn't do the public any good. The public expects services. But not having the plan, we may get into a bind where we can't come through on the commitments. Do you have any thoughts?
And I have read through and I think all of us are very much aware that is a possibility. And I have some ideas of what we could do, and of course the first being making sure that we have all of the financial information and can make the educated decisions that we need to in order to continue to go forward with Measure B. And there's almost nothing that I can do besides find the information. The decision making is certainly on the board, and the suggestions go through the committee. So I am doing the best I can to make sure that everybody has the information that they need to make the decisions that are best for the community.
Chair Hashcheck, if I may, Dr. Miller.
Yes.
I think that we could work on a draft business plan and get something hopefully to you by budget hearings, so that it would be a draft, but I think we can get you based on some of the information we've already have on what the operational costs are of the different facilities and approximately what other counties spent to construct or private entities did. I think we can get something that gives you some cost analysis around the budget hearing time, if that will work for you guys.
Chair Haschek?
Yeah, Supervisor Williams.
Maybe a way to be more expedient here. May I ask CEO Angelo, based on her knowledge of Measure B funds and estimates done at the time of Measure B inception, is there truth in our inability to construct and operate a PUF or a CSU?
Chair Haschek, did you want me to?
Okay. CEO Angelo, could you answer?
Okay, well, thank you for the question. It's a difficult question. I was not part of the group that put the Measure B initiative together, so I am not sure who the subject matter experts were that determined that $38 million could get us a inpatient psychiatric facility and one that could be operated as well. I'm not sure where those figures came from. I know the figures we did before that really showed that the county couldn't afford this. So just to, here's my answer to this question. Before the economic downturn that we are currently in, we could not afford to operate a 24-hour inpatient psychiatric facility. We now have an economic downturn where we're still in the first 5 years of collecting tax money. We're never going to make $38 million, and $38 million, I don't know where that figure came from as far as being able to build and operate a 24-hour inpatient psychiatric facility. So I think that, this is not the first time this board has had this discussion, and it's not the first time the Measure B committee has had this discussion. So we could put together a business plan and see where it could take us. But, somewhere along the line, there has to be the reality that I don't know that the figures were ever accurate to start with. I don't know where those figures came from. I don't know who the subject matter experts were that put Measure B together, and here we are. And it really is unfortunate that the public, has this perception that the government gave them that we could build this building and operate it. Thank you.
CEO Angelo, is it your preference that we don't put the business plan together because it's actually not possible to do so?
Chair Haschak, Supervisor Williams, I have no intention on this, and I have no intention. I believe if the board wants a business plan, the board should get a business plan. I also fully support Dr. Miller. I think Dr. Miller has done a great job with behavioral health, and she has made every effort she could to make Measure B work as well, and to try to coordinate Measure B with behavioral health. So I don't have an answer for you to that question. I honestly would defer to this board and to Dr. Miller. Thank you.
Okay, so Supervisor Brown, you had a motion on the table.
Yes, I did. And it was the recommended motion. And Supervisor Williams was offering some amendments. After hearing from staff, I certainly want to see a business plan. But I think I'll withdraw my motion because I'm not really hearing a suggested amendment that will allow us to move forward. I support the recommended action. I support a business plan coming forward. I think Dr. Miller has suggested, a business plan, a brief, a summary, not completely done, but to discuss during our budget hearings. But I do feel we need to move forward, at least, making the changes in the position allocations in order to get to that point. So I don't know what to do.
Chair Haschak.
Yes, Supervisor Williams.
Yeah. Do we have anyone on staff who can piece the numbers together and make the CSU or the PUF work financially? Because I've tried to put the business plan together and surveying other counties, looking at their budgets, what it costs to operate these facilities. I don't see that we come even close. We're off by millions. Do we have anyone who can do that same financial analysis? This is not my domain.
Okay, Supervisor Williams, I'm going to go back to CEO Angelo on this.
Chair Haschak, thank you. I think two things. One, the answer to that is we have no one that has the time available to do this right now. And one may say, what's more important? Well, what's more important right now is everyone is responding to a pandemic and trying to keep their staff safe. If anybody could do this, I wouldn't put this on the auditor's office, but the auditor's office is working with Miss Bailey, and so possibly they could put something together. But I think we've moved far from the agenda item, being to hire these positions to a business plan. And what I would say is that, and I have firsthand knowledge of this, that we've hired a Measure B project manager, and certainly my office gave her as much support as they could. The sheriff's office gave that position as much support as they could. I think if you go back to the agenda item, you will tie Miss Bailey's hands if she doesn't have at least one person to assist her. And particularly since the mental health team is reducing their staffing because of budget cuts from the state, they don't have the extra staff to assist her. So if we want anything done with Measure B, she has got to have at least one staff person to assist her. Regarding the business plan, it's possible that we could pull together 2 or 3 staff that could have, 4 hours or so to put something together. What we tried to do, and I want to say this because this started under the board direction and it went to me and I turned it over to Miss Bailey. But, to do this, if you recall, some of the information we were to get was from Adventist Health and looking at them as a subject matter expert on doing an inpatient facility and how we could do that. So, and again, this board had asked that we go back to Lee Kemper. Lee Kemper didn't have the time to do this. So I agree, we need the information, we need the data. It is absolutely not a priority right now to take staff off of the other activities that they're doing, which really is response, to put this together. So I would ask this board to consider Dr. Miller and Ms. Bailey's request to hire at least one person to assist her in putting together all of the projects that she needs to work on. And I would also say that we could come back, we could speak with the auditor. Between the auditor, my office, and Health and Human Services, we could come back and give this board an update on June 9th as far as the business plan, which again pushes it out another 2 weeks. Thank you.
Okay, back to the board.
Mr. Chair?
Yes.
This has been a great discussion, but I'd like to move forward on our agenda. And I think what the CEO said made sense. So I'm back to moving the recommended action without an amendment, and I hope I get a second.
Okay, I don't hear a
Mr.
second.
Chair,
So,
Mr. Chair, I will
yes.
second the motion.
Okay, and let's see, County Council needs to announce something.
Sorry, Mr. Chair, that was not with respect to this item, just before we break for lunch.
Okay, very good. So we do have a motion. We have a second. Is there any further discussion about this motion? Well, my concern is the full-time position. If we can get this business plan in a few weeks, then I'm just concerned about the expenditure of a full-time position for this work. And I'm just hesitant, like Supervisor Williams was saying, about committing more money without knowing what we're committing to and what we're able to do with it. So
I have a question for staff.
Yes.
Is there a reason why we cannot hire an extra help employee, which would not be a permanent county position, to assist Ms. Bailey?
Dr. Janine Miller, we definitely could look at extra help, but as you know, it's a process to go through the hiring process, and so that does take more time. My hope was to start, and we could still talk about extra help, but my hope was really to start with having behavioral health, at least as we can, support the position and get somebody in. So we can look at extra help. It's just, extra help has limited hours that they can work, and then it would be really hard if we got someone that was putting a lot of time in and then we hit the 1,500 max hours and had to train someone else new. So that's one of the things that happens with extra help, is if you have them working full time because you need them and then you lose them, you are starting over with training someone from scratch or waiting several months, 2 to 3 months, to hire them back on as extra help.
Part of my thought is we may have some people in the private sector who don't necessarily want to work for the county on a long-term basis, but might be available right now.
And I guess my question would be, if Dr. Miller, you were talking about a half-time position and sharing it with Health and Human Services, is that a possibility from the get-go, or is that a transitional idea?
I could take it either way. If if what you guys are willing to, if you're willing to approve at least a half-time to start, we can definitely look at that and start with taking that half-time behavioral health half-time Measure B. We definitely need the support in Measure B. Allison needs the help. And so we definitely are willing to look at that, and that we could do a 50-50 split within behavioral health and Measure B for that position.
Thank you. Okay, so not hearing any other comments, I guess Deputy Clerk of the Board, could you do a roll call vote?
Of course. Supervisor Jurdy?
No.
Supervisor Williams?
No.
Supervisor Haschak?
No.
Supervisor Brown?
Yes.
And Supervisor McCowan?
Yes.
The motion fails with Supervisors Jurdy, Williams, and Haschak dissenting.
Okay, is there another motion out there?
Yeah, I'd like to make a motion to authorize staff to hire an extra help employee to help with this project.
Could you clarify help with this project? Would that begin with completing a business plan?
That, I believe, is the board's top priority. So that would be the project really that this person would work on.
Second.
And is there a limit to this extra help? I mean, because we don't want to just hire a person as another full-time position. That's the idea, I'm assuming. So is there a time limit to it or a cost to it?
There's a requirement that the person we hire as extra help is capable of putting a business plan together. And I think we want it as quick as possible. I don't see a limit on the amount of hours. And I think we need to pay market rate. What we shouldn't do is hire somebody who can't answer what does it cost to operate a puff.
Mr. Chair?
Yes, Supervisor Brown.
Thank you. So I'm asking my colleagues, how do you see staff support going forward for Measure B committee? What is your vision?
I guess mine would be, let's start off with a half-time analyst, see how it goes, see what they find out with the business model, and then proceed from there. And if we find out that a half-time position isn't enough, then we beef it up. But if it is, and we get this business model and we find out that we're really in, bad straits and we're just spending money on program directors and project analysts and construction managers, then we, reevaluate.
So another question of staff. Will we be able to meet the deadlines set for building the CRT, breaking ground by November?
So Dr.
Miller?
Dr. Janine Miller, I can say we hope. It will probably, as I've stated before, it will be holding behavioral health staff out to do jobs that are not their current jobs. And, as Carmel Angelo stated, we've been focusing a lot on COVID and our warm line and our response to client care. So the more that Measure B does not have support, the more you are impacting the mental health system that you currently have, so especially mental health, because I'm having to pull my staff on a daily basis. And I think Ms. Bailey could admit to that. On a daily basis, behavioral health staff are getting pulled into different directions to assist Measure B and provide that support that she currently doesn't have. I would ask for one clarification on the extra help, and that would just be, we keep talking about the department analyst, but I would like clarification on the staff assistant to the 0.25, because this is the person who is supposed to do the minutes, help with the posting, and do all the Measure B committee support. So I would like some clarification on that too.
Supervisor Jurdy.
To me, I see that as really a different person than the person that is needed, a different set of skill sets that is needed to help prepare the business plan. So I'd be open to allowing the department to have 2 separate recruitments for extra help. One could be extra help, very limited hours throughout the course of the year to provide the minutes, but not necessarily being a county employee with all the benefits and everything. And then the other being the extra help, very time limited project, which is to help develop the business plan.
We have a motion on the floor.
We do have the motion. Could you repeat the motion?
This was a motion from Supervisor Jurdy, seconded by Supervisor Williams, and it was hiring of an extra help employee to assist with this project broadly.
That's pretty vague.
We can clarify this project is the business plan.
Reframe the motion.
Supervisor Brown, could you repeat that, please?
Thank you, sir. I believe we should pull the motion that's currently on the table and reword a motion that's well understood.
I'll pull my second.
So
okay,
withdraw?
I would, I'm looking for some assistance here, but I would propose we authorize staff to proceed with extra help to assist with developing the business plan. If needed, staff can bring back a proposal for extra help to conduct the minutes and post the agendas for the Measure B committee.
So if I can jump to discussion, I want to support that, Dan. But
excuse me, Miss. Point of order. You need to have a motion in a second before
I'll second it for discussion, moment for moment. If we seek extra help, is staff confident that we can find someone who has the expertise to estimate what it costs to operate a CSU, what it costs to operate a PUF with recruiting in our area? Because if the answer is no, well, we shouldn't go hiring extra help to set someone up for this impossible challenge that nobody else within the organization has been able to accomplish to date. It may be that we need a specialized consultant. We may need to work with, say, Progress Foundation. They've offered to come and help us. They run CRTs in Sonoma, Napa, and San Francisco. Maybe we involve RQMC. They have expertise in billing for mental health. Maybe we need help from an outside organization to determine what's feasible. I'm not 100% confident that just hiring somebody as extra help is going to get us a business plan that's credible. And I'll pull my second.
Okay, so we don't have a motion on the floor right now. Maybe we need to table this for another meeting.
I suggest that perhaps we table it until after lunch. I think we need to decide and not push it back.
Mr. Chair, I agree that we need to move forward on this. I don't think current staff has the resources they need to efficiently conduct their work. And maybe we could hear again from staff their view of this. Is this proposal to hire extra help really a workable solution? Or, maybe just in a nutshell, their top 1, 2, or 3 reasons to go one direction or another. And I think we do need to get this resolved. Thank you.
Okay. Thank you. Staff, do you have a comment on that? And
I do. Thank you. I think that hiring somebody to help me for a short time to get the numbers and feasibility done would be an enormous help. Also, it would keep behavioral health from having to train somebody new, and for me to need to supervise somebody instead of just move forward on the goal. As far as help with the administrative things, I do need that. I think that 0.25 it would be just enough. Maybe even closer to a third of the time would be better. There's a lot of administrative requirements. Thank you.
And here, Chair Haschak, Dr. Miller, I'd like to add one thing. I think having an extra help staff assistant would not be as beneficial as we are putting them forward that behavioral health would carry 0.75 of the staff assistant. We're only asking Measure B to cover 0.25. That allows consistency. The person's trained. Allison can have, they'll know more of the county processes and practices. So I think that you already have a full-time staff assistant. We're willing to just ask Measure B to pay for the time that that person assists Allison to get the job done. I think that's way more beneficial than doing an extra help for that position. Extra help is better than nothing for the department analyst. Whether we can find an expert, at least that person could consult with experts. And like I said, we're also willing to do a 50-50 with behavioral health, doing 50% of the department analyst, and Measure B paying for 50% of the department analyst.
Right, thank you. Is there a motion out there? Or should we table it? Why don't we table it until after lunch? We do have a 1:30 presentation. That's a set time. So we will take this up again after the 1:30 presentation.
Chair Haschak.
We've got closed session right now that we need to get to too. So Supervisor Williams.
Yeah, I was going to ask would you entertain creating an ad hoc to bring back a business plan?
Mr. Chair, I would suggest that's a little bit off the topic of this particular item. This had to do with the creation of a position and adding staff. There's a little bit of overlap in terms of what the need is, but I think tackling that issue rather than creating the staff might be a little bit more appropriate as part of a separate item.
Okay, so for right now, let's table this motion and we will go to lunch break.
Mr. Chair.
Council.
Mr. Chair.
Yes, Supervisor Brown.
Thank you. I don't believe we do have a motion on the table.
No, we don't. So that's why we're going to table this item.
Agenda item.
Okay, sorry about misstating. So we will table the item until after we come back and deal with the 1:30 set time item. And then the County Council, you had something to say before we break for lunch?
Yes, thank you, Mr. Chair. Just with respect to the closed session items 9A, 9B, and 9C, my understanding is that the clerk of the board staff has been having some technical issues in terms of uploading the public comments there, and that what public comments have been received have been uploaded under item 5A. I just want to make sure that both the board and the public is aware that that's the location that those are publicly posted, while the clerk of the board staff is sort of working out the technical side of things. Thank you.
Okay, thank you. So we're going to go to closed session at lunch. We're going to deal with items 9A, 9B, and 9C. And when we come back at 1:30, we will deal with item 5F, which is a timed item. And then we will come back to item 5L. Okay, very good.
Mr. Chair, is there a little bit of a break so we can get ready for our working lunch closed session?
Yes, we will have 10 minutes and we will start back at 12:18.
Thank you.
Okay, very good. Okay, so until 1:30, we're in recess except for the closed session.
Good afternoon. We will be returning to open session at 1:38 after the conclusion of closed session. Thank you.
So we're back from our lunch recess. We only dealt with item 9C, and we will have to return to that when we come back. And we will have a closed session at the end for items 9A, 9B, and 9C. So going on to item 5F, which is the timed item, discussion and possible action, including acceptance of the Mendocino County Employees Retirement Association actuarial valuation for the fiscal year ending June 30th, 2019, and adoption of the Retirement Board recommended retirement contribution rates for fiscal year 2020 and through 2021. All right, the sponsor is the Mendocino County Employees Retirement Association. So is Dr. Wilbanks here, or who's going to present for the Mendocino County Employee Retirement Association?
Yeah, good afternoon, members of the Board of Retirement. My name is Andy Young, representing the Fiscal company. I'm not sure if Dr. James Wilbank would be with us today. So I think I would take the liberty to walk the Board of Supervisors through our June 30, 2019 valuation, if it is okay with you.
Okay, very good. Thank you.
Okay. Now, I know that we have provided a copy of our PowerPoint presentation. So I don't know if it is your preference of the Board of Supervisors for me to share my screen so that we can walk along, or would you rather look at your either electronic copy or hard copy that you may have with you?
Well, it might help to show the screen as we go along so everyone can see it.
Absolutely. So with that in mind, I will give it a try. Share, so hopefully it will work. Okay. Okay. All right. Okay, good afternoon. Again, this is Andy Young from Fiscal company. What the agendized item is there today is for Fiscal to present the results from our June 30, 2019 valuation. And let me first start off by sharing the purpose. Of course, this is a very loosely stripped presentation. So if there are any questions, feel free to stop me during the presentation, okay? We do this valuation once every year. I know that we have a practice to present the results in front of the board. Every year, this is a little bit later than usual, but in any event, the purpose of the valuation is to summarize the results, the data that we use in the valuation. It analyze the preceding year's experience. So in this case, because we are showing up a little bit later than usual, I want to remind the board that this is the valuation as of June 30, 2019. So for that reason, anything that we capture, including the financial result as well as the membership data, are as of that date, June 30, 2019. So this means that anything that has happened, and a lot of things that happened, as you know, after June 30, 2019, those have not been reflected in the results of this valuation. So once we go through the result of the valuation, and the purpose of today's presentation is to really present the contribution rates, not just for the employer, the county, but also the members' rates, so that once they are approved by the board, they can become effective starting with the 2020-21 fiscal year. When we talk about the actuarial valuation, it's almost like performing an annual physical examination for the retirement system. And again, the two items that we can count on changing routinely every year would be the membership data, or even though there's almost always a good pattern that we can predict as to how many members we have in the last valuation and how many members do we have in the current valuation, how many members are expected to retire, for example, if the assumptions were to come true. However, the one item which is very highly unpredictable would be the financial experience. So for example, in this valuation, it bears me to repeat that all the financial results that we have are as of June 30, 2019. So all this volatility in the market that have taken place pretty much now on a daily basis since June 30, 2019 have not been reflected, and they won't be reflected until we do our next valuation as of June 30, 2020.
And I think, Mr. Young, that's one of the big concerns that I'm feeling is that if we're going into this depression, that the valuation is unknown, like what the results will be going forward.
Yeah, that's a point well made. I think as we go through the presentation, one thing that is somewhat at least reassuring is that in the valuation, even though we know that we can only pay our retirees benefits based on what is in the retirement trust fund, we can only use market value of assets to pay those benefits. However, we know that the market value tends to go up and down on a daily basis now. It used to be monthly and used to be annually, but now it's doing that on a daily basis. So for that reason, the retirement board has a so-called asset smoothing method. So what we do is we take the gains and losses in the market and we actually smooth it out, recognizing that they change very unexpectedly. But we smooth those experiences over a period of 5 years, especially to address the concern that you have made, that how can we set a contribution rate for the county, how can we set a contribution rate for our members, knowing that the assets value are so highly unpredictable. So for that reason, we don't use market value. We know that the market has a tendency to go up 1 year, and then as has been the case since the 2008, 2009 housing bubble, housing recession, they tend to return at least some of the losses to us in the following year. So we're hoping that this could be one of those, but again, we're not at the point where we are going to go through this annual physical examination again, because that would be until June 30, 2020. So hopefully we have better news to report back to the board once the year is over, because we will just have to wait and see what's going to happen in the next 2 months or so. Now, when we go through the evaluation report, there are usually two costs that you will see. One is the so-called normal cost, so that is the cost to provide our active employees with 1 additional years of service credit. So for example, if I'm one of the long-term employee of the county, I'm expected to work 30 years before I retire from the county, then each year I work, about 1/30 of that cost has to be paid for by the employer as well as for the employee. So that's the normal cost. However, if I were to be one of those employees, if I've already worked 15 years for the county, then one can argue that, well, those 15 years that I have already accrued in the past, I can count on. That's the actuarial, the accrued liability. So the question that we have to confront with in the valuation is how much assets have been set aside to provide for that 15 years of past service, and whether or not all the assumptions have been made, especially have we earned enough assets and enough return in those assets to cover that past part of the liability. So if we look at the funding requirement for the plan as a whole, what we first and foremost try to answer is, do we have enough assets? So this is the green piece of the pie to cover all the past liability that I was talking about in using my hypothetical example. Now, in this case, as we'll go into see, there's a unfunded actuarial accrued liability, meaning that the liabilities are bigger than the size of the assets. So what do? So we actually have to have a payment plan. It's almost like a mortgage concept. Anytime we owe the bank money because our house is not paid for, we have to go to the bank and arrange for the mortgage. So that is the wedge in this pie chart, which is in the 1 o'clock. So this is every year when there's an unfunded liability, rather than to ask the employer, the county, for example, to pay us back all the unfunded liability, we actually have a payment plan. We will only ask for the county under the Board of Retirement Funding policy to pay us back the piece of the wedge of the pie that is called for under the current year's UAL amortization. However, every year when the employee works for us for another year, there's always an additional normal cost to be accrued. So that is the piece of the wedge, which is in the yellow, almost like in the 7 o'clock column. So when we go through and set the funding contribution rate requirement, is really the addition of the current year's normal cost to the amount of the current year's unfunded actuarial accrued liability that needs to be paid for. So I think I've already covered most part of this current funding policy. Now, the only thing that I want to reiterate is the asset smoothing methodology. Now, as we'll go through in the next several minutes, 2019 actually was also another great year for the Retirement Association. We expect the fund to earn about 7% rate of return. The actual rate of return on the market value basis has come in below 4%. So as a result, we have to recognize some of those losses, but not all the losses between the 7% that we expect the fund to earn and the 4% that we actually earn. So the concept about the asset smoothing method is anytime we earn less than the assumed rate, rather than to ask the county to pay us back all those losses right away, those losses, as we have indicated here, will be spread out and recognized over a period of 5 years. So I want to also highlight how things have changed in just a short span of 1 year between the last time when I appeared in front of your board and this time when I present the result to you for the June 30, 2019 valuation. Because when I was there last year, the plan actually have some deferred investment gain because we were coming out just from a great market year in 2018. As a result, we haven't recognized all the gains. So the beauty about this asset smoothing methodology is when times are great, such as when it was in 2018, we don't recognize all the market gains right away because we felt that it might rain and we can hold on to some rainy day fund. So as a result, as part of 2018 valuation, we're holding on to gains of about $10 million. However, it did rain in 2019 because the rate of return came in lower than the 7%. So we have to effectively use up all the gains. In one short year, we use up all the gains of about $10 million. And now we only have a gain of $35,000. For fund our size, you can almost call that we basically have no rainy day funds left over from 2019. And so what do we do when the plan is an unfunded liability? Like I said early on, we actually arrange for a mortgage payment. Anytime we have an unfunded liability, in any new unfunded liability, that mortgage payment is expected to be paid off over a period of 18 years. So anytime you have an unfunded liability, such as what happened when we go through some of the reasons why we have added some new unfunded liability besides the investment losses, we took those amounts and amortize that and have that to be paid for by the county over a period of 18 years. Now, of course, when I talk about the county, I should remind myself that the county, as you know, is the biggest employer within the Retirement Association. The court, as well as the cemetery district, are also employers within the Retirement Association. So this is really a snapshot of how many members we have in the plan between 2018 and 2019. So you can see that the number of active employees that we have relatively flat from 2018 to 2019. As a matter of fact, if we look at the longer term view from 2015, you saw that, well, we used to have about 1,100 active employees. Today, we have about 1,151, so almost flat from 1 year to the next. However, that's not the case. If you look at the number of retirees, folks who are relying on the retirement system, the Retirement Association, for a lifetime pension benefits, because those number of retirees actually have gone up steadily over time from about 1,300, 1,400 in 2015 all the way to 1,500 today. So one thing that we have been sharing with the Board of Retirement as well as the Board of Supervisors is that we are one of the so-called more mature system, meaning that as is almost always the case with the retirement fund, over time, we expect the fund to have more and more retirees. So certainly that's definitely bearing out to be the case at MSERA and Mendocino. On the other hand, we also expect the number of active employees to be about flat from 1 year to the next. But in this case, because of, as the Board of Supervisors is aware, budgetary constraints and whatnot, the number of active employees actually have not grown. As a matter of fact, when I go back to the first year, when I was the first appointed as actuary for the Retirement Association, I think we have well over 1,200 employees back about 10 years ago. So certainly the county has gone through some pretty tough times as evidenced by the number of active employees. So if you look at the number of, at the value of the benefit that are being provided to our retirees, the value of the benefits staying relatively flat. After all, if you take a look at the annual benefit, $2,300 divided by 12, one can almost argue that this is really just a an average value of benefit. So it only amounts to about $2,000. So whereas our active employees, again, you look at their salary, $61,000 per year, $5,000 a month. So this is one page where we go through the comparison of, remember the pie chart that I was talking about, comparing assets to the liability. So if all the assumptions were to come true, if we have always earned the assumed rate of return, we would expect the fund to have about $747 billion. So this is the amount of liability we have today. However, not all the assumptions have come true, especially the rate of return. There were also some instances when the actuarial assumptions were tightened. But in any event, because there was more liability than assets, the plan is funded at less than 100%. So this funded status is simply a ratio that we calculate by taking the amount of assets we have in the plan and dividing that by the liability. So one can argue that because the plan is funded at 70%, 71%, then we only right now have 71 cents of assets to cover each value of liability, each dollar worth of liability. So if we now, instead of taking the ratio, you can take the difference between how much liability and assets we have, and there's a shortfall of about $219 million. If we measure the assets on a market value basis, there's one item called a contingency reserve that we net out of the equation, but more or less you're coming up with an unfunded liability for the plan of about $214 million. So on this next slide, we talk about the contribution rates, see how they have changed from the last valuation as of June 30, 2018 and 19. There are different rates that we have calculated in the valuation for each of the three main membership groups. They're the county general employees, the safety employees, as well as the probation officers. But if you look at all the contribution rates for all the three employee groups combined, the total contribution rate has changed from about 34.1% of salary to 34.6% of pay. So in dollar terms, you can almost say that, well, for a fund our size, it's relatively stay put from about $24.2 million to about $24.5 million. So at least for this particular valuation, contribution rates have gone up for a couple of reasons that I'm going to talk about, mainly because of investment losses. But otherwise, the contribution rate have really not changed by too much from the last to the current valuation. Now, I think I have already covered part of the actuarial experience, especially dealing with the investment losses on the market value basis. Again, only up through June 30, 2019, the market rate of return has come in at about 3.86, 3.9%. We expect the fund to earn 7%. And after going through the smoothing methodology, in which we take only 1/5 of the investment losses, plus we take into account the rainy day fund that we've carried over from the 2018 valuation, if we put all of those together, the rate of return on the smooth value basis, which we use for the valuation, has come in about 6%, so which was only 1% below the 7% that we expect the fund to earn. But it bears reminding the board that even though we have a not so great year, we have a bad year, the investment did not come in at the assumed rate of 7%, but we were fortunate enough to have the investment gains from the prior year that we used to effectively buy down a lot of the gains, a lot of the market losses that would otherwise take place. So some summary is, bottom line is the contribution rate for this valuation has gone up incrementally from about 34.1% of payroll to about 34.6% of payroll.
And excuse me, for the county, that means about $300,000.
At least for this year, correct.
Right. Okay, thank you.
Thank you. So on this table, remember I said when we compare the amount of liability we have in the plan versus the assets, there was a shortfall of about over $200 million. So there was a change from the unfunded liability determined in the last valuation report to the current report. So this schedule basically goes through where we would expect to be at if all the actuarial assumptions were to come true. The unfunded liability of the plan would have decreased incrementally from about $212 million to about $211 million. Now, as is almost always the case with the mortgage concept, you can say, well, how come the county was making its contributions, the court was making its contribution, and likewise the cemetery district. How come if all the assumptions were to come true, the amount of the unfunded liability of the plan would only have gone down by about $1 million, right? After all, I said the amount of unfunded in the plan at the beginning of the year was $212 million. If all the assumptions were to come true, it would only be 211. That has to do with the fact that when you talk about the mortgage, the question is, how long do you want to structure the mortgage? And it goes without saying that the longer the mortgage payment, the more interest the payment would go towards in the initial first couple of years in the mortgage payment. And that's exactly what happened, because on an average basis, if we look at everything together, the mortgage that we're looking at for the unfunded liability of the plan is about 18 years. If I look at all the mortgage payments that we'll look into in the next chart, but so it's a relatively longer payment period. But nonetheless, interest is being paid towards that unfunded liability. So we would expect to see a more gradual and more dramatic reduction in the interest, therefore the paying down the UAL. And there's a chart that will show us that. But in any event, not all the actuarial assumptions of the plan has come true. So for example, I've already said that the investment experience was worse than expected. So that contributed to an additional unfunded liability of about $5 million. Also, there was some higher than expected salary increase. I think this is something that is very cyclical, something that we have seen 2 years in a row, starting with the 2018 valuation. I think that was when some of the more recent collective bargaining agreements have come to close, and there was a need to provide those salary increases that have been maybe held up for a couple of years because of budgetary constraints. But in any event, we do have a salary loss that contribute to an increase in the unfunded liability of about $5 million. So there was some positive experience, but if we look at all the line items together, they all add to the unfunded liability of about $8 million. So taking us from about $212 million at the beginning of the year to about $219 at the end of the year. So this is just a chart that we have in our valuation report. The question has always come up. So exactly how long would it take for the unfunded liability of the plan to be paid off? And this is really a diagram providing the employers and providing the board with how long it would take and how gradually it would basically the unfunded liability would be paid down. I think when I look at this chart, there's a lot of information that was not available because we have to restart some of the amortization. But if you look at the size of the chart, so this is the pieces that went into the $219 million of unfunded liability we have in the plan today, you can see almost one half of that amount of unfunded liability was caused by an assumption change. So the board may wonder, well, how come could an assumption change increase the amount of the unfunded liability? So this has to do with the fact that anytime we recommend to the Board of Retirement, the Board of Retirement adopt our recommendation to use more conservative assumptions. So for example, when we recommend to the board that they lower the investment return assumptions, so what we would do, the actuary would do, is immediately use those more conservative assumptions to reevaluate the liability. So this would be the no good deeds would go unpunished. Anytime we change to recommend, we change to more conservative assumptions, the liabilities are being remeasured using those assumptions, and they would immediately put a bigger liability on the books for the retirement association. So that is really one of the reasons why over the last maybe 10 or 15 or so years, the amount of unfunded liability has gone up, and that is partly because of the fact that the assumptions have been remeasured, they've been tightened, they've been made more conservative. So again, the Board of Retirement has a policy to review those assumptions every 3 years. So this actually would be the last year we're carrying over the same assumptions that was reviewed 3 years ago. So, and again, something that we will be working with the Board of Retirement within the next month or two, working on what we will be recommending as far as actuarial assumptions for the next 3 evaluations. So I just want to provide that perspective, just in case you wonder why there was so much increase in the unfunded liability because of this so-called assumption changes. So this is a similar looking chart, except that this shows how much would be expensed towards the payment of the unfunded liability. And so going back to the comment that I made early on, in about 20 years or so, 18 years or so, the amount of the unfunded liability of the plan, the entire amount of unfunded liability of the plan would be expected to be paid off. Now, of course, that's also under the assumption that there will be no other future experience gains and losses, no other investment gains and losses, and no other assumption changes. So if we just take a static look at how much is on the books today as far as unfunded liability and how long it will be pay off, and the answer is about 18 years. But that's under that very idealistic scenario that there will be no other changes. So last but not least, there's another schedule which goes through this time, instead of reconciling the change in the unfunded liability, really the change in the contribution rate requirements. So some of the items that we've talked about, for example, investment experience coming in less than expected, higher than expected salary increases, those items are all appearing on this page. The only item that is new, that is on this page but not on the other page, has to do with the fact that when the payroll for the county and the other employers have come in higher than expected by our actuarial assumptions from one valuation to the next, which is currently 3.5%. Effectively, what we would do is to take the unfunded liability plan and spread it over a bigger payroll base, so that has a small positive impact on the system as a whole. So on a net basis, the amount of the contribution rate is going up by about 43 basis points, by about $3 million from the last valuation of 2018 to the current valuation as of 2019. So now I know that I've gone through very quickly based on the time allotted to this part of the presentation, and so I will just pause to see if there are any questions. I'm sorry.
I'll ask a question. Yeah, so Andy, thank you for the presentation on the annual actuarial. In addition, there may be people watching this meeting that haven't seen this before. Every 3 years, you also do a more deeper dive into the valuation, and that's where you look at other factors that affect contribution rates. So, for example, there's just a trend that people are living longer, and so if they live longer, they receive the benefit later, for more years. And so you've taken that into account, and that's done in your every 3-year analysis. So can you kind of go through some of the examples like that you look at every 3 years?
Absolutely. I think, Supervisor, you're right that first and foremost, we are here to answer the question how long our retirees are going to live after they retire from the county, for example. And so it goes without saying that what is good for the employees or the retirees may not be great for the retirement association. So, for example, if our retirees are living longer than what are expected by our current mortality table life expectancy, then we would need to project a bigger liability, set up more funds in order to provide that retiree and his or her beneficiary for their longer retirement. So that is definitely something that we look at, is called a mortality study. And there has been experience out there that our retirees, generally speaking, are living longer. It's nothing to do with a public plan in particular, but basically all retirees are living longer. So again, it's good for the retirees, but that means more money needs to be set aside by the employer. There are also pressure on the investment return assumption. So the investment return assumption is really made up of two parts. It's an inflation assumption plus a real rate of return. Right now, in the current valuation, we are using an assumption of 3%. So we know that that assumption has got to come down. And the reason why I can say that is Fiscal and basically actuaries in general only have one inflation assumption for each actuarial firm. So the answer back 3 years ago when we did the experience study for the board was 3%. So back then we were feeling very comfortable. Now, since that date, we know that we have been bringing our clients down from the 3 to the 2.75%. So I think everything else being equal, there's certainly a downward pressure on the current 7% investment return assumption, because that assumption was made up of a 3% inflation plus a 4% real rate of return. So those two assumptions are by far the assumptions that have the most impact on the retirement association. Now, I think the one other assumption that we will be needing to take a very deep dive has to do with the merit and promotion assumptions. I think as part of the presentation, I alluded to the fact that during the last 3 years, I know that there were some bargaining agreements that had come to an end. They were extended. I think there were some bargaining agreements that rightly so have rewarded and will continue to reward our employees, those who are particularly career employees. But I think because those those salary assumptions were last looked at 3 years ago before the current agreements will come to pass. So definitely we will need to take a look and see whether or not those assumptions will need to be tightened up in the next experience. So it's something that we will do actually in the month of June and July. So very soon, coming out very soon.
Okay, thank you.
Are there any other questions from the board? Hearing none, we will go to public comment, but we don't have any public comment. There's none, no public comments were submitted. And so back to the board. Is there a motion to accept the presentation or any action? So I guess we can just accept the presentation. And thank you, Mr. Young, for your presentation.
Thank you. And I hope that I can be in front of the board next year.
Okay, we hope so too.
Yeah. Okay.
Okay. Okay, so we're going on to continue on with agenda item 5L, which we had discussed earlier before the lunch break. So we had some motions that did not pass. Is there any motion or a way to proceed from the board?
Mr. Chair.
Yes, Supervisor Brown.
Thank you very much. From our discussion earlier today, I strongly believe staff heard our discussion on this item, and I do believe they'll be very cautious in filling the positions. As I stated earlier, actions have already been taken by this board as recommended by Measure B, and those approved processes need to continue moving forward, including the CRT project. Keep in mind the $500,000. I do believe the need of a business plan. I think we all supported that. But the work on this particular agenda item was approved to go forward. I think, the amount of work done, it's here. I also think I don't want to belabor this item any longer. And so I'm going to once again move the recommended motion.
Well,
Mr. Chair, I will second.
Okay, County Council, is that appropriate to bring back the same motion?
Mr. Chair, I understand from the clerk of the board that the first version of the motion was actually amended. This may be actually the first time that the motion has come forward in this incarnation.
Okay. All right, so it's been moved and seconded. Any comments?
Yeah, my only comment is we passed an item back in early December. That would be about 5 months ago, to get a business plan before spending more money. I feel like we're going against that. And I understand we need the resource in order to get the business plan, but I think the supervisors also need to decide what it is we want to build, what services do we want to provide. And I'm not confident that this will get us there. I would feel more confident bringing Sheriff Allman back to, finish writing out his vision and get him working on the financials. I just don't have a lot of confidence that in July we'll know any better what it is that we're building and what we can afford to operate than we do today.
And my feeling is, let's see, I was going to make a comment about the motion. So my feeling is that, I just don't want to hire a 1.0 FTE analyst when I think that we're looking at a business plan and we can do that in several weeks, or, the draft, they say they can come up with in a couple weeks. And so I would like to hold off on that position until we have a business plan. And if it takes, temporary or sharing an analyst with HHSA, I would be up for that. So I'm not in favor of this hiring the 1.0 plus the 0.25. The 0.25 I think is a different issue, but the 1.0 is just too much for me. Okay, Supervisor McCowan. Supervisor McCowan.
Oh, I'm sorry. Switching back and forth from mute to unmute. Thank you, Mr. Chair. I agree with Supervisor Williams' comments. It's not too late to do a business plan, but we're hearing there's nobody to do it. The best time to have done that would have been before the item actually came forward and was voted upon. That didn't occur. I'm concerned that we're at a point now where the Measure B project manager really does need help. I agree with Supervisor Brown's comments that staff will be judicious in moving forward. If I'm more concerned about the delay of getting the needed help than the relatively small additional amount of funds it would cost to move forward at this time. And we run a real risk of not meeting the state deadlines for securing the $500,000 grant. Thank you.
Okay. Any other comments from the board? Okay, hearing none, we will go to a roll call vote. Deputy Clerk.
Hi there. So just a reminder to please mute your microphones when you're not speaking, and we'll go ahead with the roll call vote. Supervisor Haschak?
No.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Supervisor Jurdy?
No.
And Supervisor Williams?
No.
The motion fails with Supervisors Jurdy, Williams, and Haschak dissenting.
I'd like to offer yet another motion, a different motion, and that would be to authorize the 1/4 time shared position with 1/4 time paid by Measure B, 3/4 paid by behavioral health for administrative functions, and an extra help assistance for completing the business plan.
Second.
Okay. Any further discussion?
May I please have a repeat of the motion?
The motion, it would be to authorize sharing a position between Measure B and the behavioral health, 1/4 of the position funded out of Measure B for administrative functions as proposed, and the an extra help position authorized to assist with the development of a business plan.
Okay, so any further comment from the board?
Mr. Chair?
Yes, Supervisor Brown.
That would mean amending the resolution as well?
Supervisor Jurdy.
Yes, staff, I believe, could do that after our vote.
I would ask County Council.
Mr. Chair, I'm just trying to make sure that I'm following along. If I understand correctly, the proposal would be to amend the resolution so that instead of referring to adding 1 full-time equivalent and 1/4 time equivalent, it would simply be the 0.25 equivalent shared with, I'm not quite sure if that's a creation of a 0.75 or an existing 0.75. But then additionally, there's a budget move that was also on the resolution. I'm not quite sure if that was as intended as part of the motion or not.
Supervisor Jurdy.
We would be authorizing a extra help employee, but that we're not creating a new county position.
But it seems like with the budget unit, that would be shifted to reflect the Measure B portion of it, of the administrative assistant.
And that needs to be mentioned in the motion.
That's your understanding, Supervisor Jurdy?
Yes, and if staff needs some time to memorialize this in the resolution and recirculate it, we could they could work on that while we go into closed session and deal with our remaining closed session items.
County Council, would you need more time to do that? Or do you understand what we're proposing, or Supervisor Jurdy is proposing?
I believe I do. I'm gonna. I can ask one of my deputies to work on this while the board continues along. The only thing is that when we have a draft back, I'm going to want to ask the board to take a look at it, make sure that it's accurately capturing the intent of the motion. I guess before the board does that, I'm a little leery of doing the drafting. If we could maybe have a motion of intent to this effect, so that we know that it's going to pass before we come back with a modified document.
Certainly. Okay. I guess my concern would be with that, with the temporary position, and I'd like to see some constraints put on that, because we don't want to just hire the 1.0 FTE as a temporary.
Chair Haschak?
Yeah, I hope that's understood.
I would ask that we attempt to hire retired Sheriff Allman as the extra help, given that Measure B was his vision, and he may have better insight into how to carry it out in line with what was committed to the public. And there may be some compromises on the table. We may not be able to do all that we envisioned. Get help ranking those priorities comes down to more than just trying to fit a round peg in a square hole. And I think the sheriff retired Sheriff Allman would be in the best position to help balance those trade-offs.
Mr. Chair, if I may, I just want to raise a couple of legal issues with that proposal. One is that I believe that Mr. Allman is currently on the Measure B commission, which does have the potential to create some incompatibility of offices issue. But additionally, I don't immediately know whether a extra help position would be exempt from the civil service requirements. But if it's not exempt from those hiring requirements, I don't know that the board can sort of designate a preferred employee in advance of creating the position. So I would just caution the board that that might not be possible.
So if I may continue, Chair, I'm worried about hiring extra help to essentially put together a strategic plan. Strategic planning needs to be done by this board. And so I think what we might be asking is for a financial analysis. This brings us back to the item we passed in December. What will it cost for the various components? And if we can't afford it all, which components can we leave out of the final solution? You can't expect extra help to put that together in the form of a business plan. I think that's for us. So maybe I could ask my colleagues, what do you envision us building and operating?
Well, Supervisor Williams, let's keep it to this position of the analyst. And let's focus on this, the analyst position. And I hear that we're trying to do this business plan. And that is going to be kind of a a budgetary kind of person who can deal with the issues and look at what the costs are going to be. But let's just deal with the analyst with the intent of doing a business plan.
My comment was in relations to the analyst to do the business plan. Are we confident that we can get an analyst as extra help who has the capabilities to put together a business plan with financials for a mental health hospital?
Do you have an alternative proposal, Supervisor Williams?
Well, if we can't, let's not go down the path and then 5 months from now.
What you've said and what the board members have said is they want information. Information comes from people like analysts. Decisions come after that information is presented. So of course the decisions would go back to the board, but the decision would be based on the information presented.
So I agree with that. I'm pointing out 5 months ago, we passed a very similar item to what we're talking about now. It was to bring back this information, which hasn't come back. So it may be that we don't have the staff to do it internally, and getting extra help makes sense. But extra help versus, say, a consulting firm that specializes in this particular, I can't believe I'm raising special consultants of all people. But what I don't want to do is months from now be talking about we still need the information, and we're already 5 months into it.
Okay, so we have a motion on the floor, don't we?
Yes.
And what is that motion?
This was moved by Supervisor Jurdy, and it was sharing the position between behavioral health and Measure B with 0.25% funding for Measure B with extra help authorized to assist with the development of the business plan.
All right. Any further discussion? Okay, so Deputy Clerk, could you do a roll call vote?
Absolutely. Supervisor Brown?
No.
Supervisor McCowan?
No.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
And Supervisor Haschak?
No.
The motion fails with Supervisors Brown, McCowan, and Haschak dissenting.
Now, is there a motion that if we could put some limitations on this extra help and a price value on it?
I believe County Council can explain that there is state law already limiting the amount of money that can be spent on extra help.
Chair Haschak?
Yes.
Could we ask the auditor to help with this analysis?
I don't know. That would be an auditor question, I guess. Hey, County Council, what is the value? What's the limitation to what you can spend on extra help?
And my apologies, Mr. Chair, I don't have it in front of me. It is in the civil service rules. If you give me just one moment, I'd be able to pull that up. Mr. Chair, I believe it's 6 months. I'm just looking to verify that at the moment.
It was what? You got?
Sorry, 6 months.
Oh. Okay. Is there any other motion to be made?
We have Johnny Cranmer on the line who would like to speak to this item.
All right. Okay.
Good afternoon, board members. This is Johnny Cranmer, HR manager. I just wanted to say that for extra help, they are limited term, not generally to exceed 6 months. They are not covered under civil service, so they do not need a regular recruitment process. And occasionally when departments put in a request, they already know who they wish to hire for extra help because the person has expressed an interest and applied and been approved as qualifying. That's all I have.
So if I may ask a question, you said we can specify. Would you see any issue in a special request to retired Sheriff Allman to help us with the financial planning of his vision?
I think that would be up to him, but I've never seen a board action to specify hiring someone in particular, but there's not a requirement for a recruitment in civil service exam for extra help.
If I may add, Mr. Chair.
Yeah, County Counsel.
First of all, I want to thank Ms. Cranmer. She was able to clarify a few of the points I didn't have off the top of my head. I do still have some concerns from the potential incompatibility of offices. So if the board were to give any direction to that effect, I'd recommend that it would be contingent upon a determination that it wouldn't be a conflict of interest for him to be both on the commission that makes recommendations as to the funding of a position that he would be occupying and occupying the position that is paid with those funds.
Chair Haschak?
Supervisor Brown.
Thank you. I would like to remind Supervisor Williams, and this is no critical comment towards former Sheriff Allman, but he did chair the Measure B, and I believe it was during its first full year. And I believe a strategic plan was asked for by at least one, maybe two members of Measure B, and a cost analysis. So I just want to put that out there. Maybe I'm totally wrong, but that's how I remember it.
Okay, so maybe a different path would be a couple of us supervisors could bring back a plan for one component, say the PUF. And if what we bring back shows that a PUF is not feasible, maybe we can all agree to cross that out. We can't do it and move on to the next item. Maybe we do it piecemeal as a group. Well, we can't just keep the same pattern of send it over to Measure B oversight and expect that they're going to come up with an answer. I imagine they're volunteering, they're trying their best, but they don't have the resources either to do the financial analysis.
Hey.
Well, I believe there are conversations going on with Adventist Health about a PUF. And I believe there were a cost analysis presented at the time we applied for the grant. So I think that information could come back. So we can all look at it and discuss it.
I guess from my point of view is that now that I know that this new information about the scope and the time limit for this extra help position, that's new information that I didn't have before when we voted. So I could see with this new information, maybe considering it.
Chair Haschak, excuse me, we have Auditor Lloyd Weir on the phone.
Okay. Auditor Weir.
Yes, hello. Can you hear me?
Yes, good afternoon.
Hi.
Go ahead.
Can you catch me up here? What are we discussing? I was on another WebEx. I'm sorry.
Supervisor Williams was asking if your office could help in coming up with a business plan for Measure B.
So Lloyd, if I could narrow it down a little bit, I don't expect your office to do a full business plan. We're in a difficult position. The public passed Measure B expecting certain services, which require facilities. We've begun the effort of planning and getting architectural work to provide those facilities, but we don't know if we can operate the services inside. We need some financial projections on what it costs to operate a psychiatric facility. Is that something that your office could help us with? Well, today, just in case you haven't been following, we failed to hire a full-time employee to assist with this. and we failed to hire extra help. And there are some limitations with the extra help. Really, we need somebody with financial skills who can look at what a PUF or a CSU or a CRT costs to operate in neighboring counties and add in the cost of recruiting to our area, training, whatever may be site specific.
Yeah, so financially, I'm able to help on that. And I have been working a little bit with Allison on the Measure B plan. What I'm lacking would be the mental health background to, kind of understand what services we need to value. So, as long as I'm working in conjunction with Allison and someone from mental health, I'd be happy to work with her to develop a strategic plan for that, or a financial plan for that, if we can.
Fantastic.
Okay.
Mr. Chair?
Yes. Supervisor?
I just received a text message from a constituent, Jan McGorty, that wanted to speak on mental health and funding, but evidently was not on the line when you had public comment.
We don't have a request to speak from Ms. McGorty. We never received one.
Yeah, unfortunately, she was supposed to call in before 8 o'clock. And so I think it would be inappropriate to take the call at this point, since we haven't done it for anyone else.
Mr. Chair, point of order, maybe we should do it for anyone who manages to get through and request public comment. I think it'd be a pretty bad precedent to deny that. And obviously, we could probably improve our practice as we go forward, but I would be in favor of hearing from Ms. McGorty.
And it might be that we want to bring Dr. Miller back to talk about the analysis that was done on the CRT. And I believe we do have some information on a PUF, but we would have to ask Dr. Miller.
Mr. Chair, if I may.
Okay. Yeah. County Council.
We're starting to get a bit off topic here. I would just recommend that the board keep it tied to these positions, and whether it wants to create these positions or take some other action related to them.
Right. And if the board wants to hear from Ms. McGorty, then we can. Supervisor Jurdy, what do you say?
I don't have a motion on the table, do I?
No, we're just trying to see if we should go to Ms. McGorty, who called in. So should we take this as a public comment?
Is she there now?
Excuse me, I'm sorry. We can't just go to her. She's not on the line at all.
Okay, thank you.
Then we'll pass it by.
Okay. So we don't have a motion on the table. We're still trying to deal with these positions, and
but the bottom line is it's over the financial. So I'd like to hear from Dr. Miller to basically address the issues that you're bringing up. I should say Supervisor Williams. I've heard these figures before. No, it hasn't come in a full plan with full discussion. But I really feel there is information there that can guide us. But we've already started processes that we need to keep going on in order to make deadlines in leveraging funds that add to our Measure B funds, or we're going to lose some.
Well, I think that certainly Dr. Miller can talk about this, but the intent is still to go ahead with the CRT. We're just trying to deal with this agenda item, which is, are we going to hire this analyst of some sort?
But what I was hearing, they need the individual to do the accounting and to keep everything moving forward. I forget where I put my agenda item here, but it explained exactly the reason that they needed these individuals, and that is to carry on the work for Measure B.
Is Dr. Miller on the line?
Yes, Dr. Janine Miller. Thank you. So one of the things I do want to remind everybody, if you have not seen it, in about 2016, we did a cost analysis of what it would cost to bring some facilities to Mendocino County. And one of them was regarding a psychiatric health facility. And that was brought to the Board of Supervisors. So there was a plan presented, I think it was in 2016, where we gave some cost analysis and what we thought it would what would it cost for the county to run different facilities? And we had a variety of facilities in there. That might be a starting point. I also want to say we did do some preliminary work, and I did present it to Measure B on the estimated cost for the 3 facilities. One, what it would be the estimate to build them, and 2, what the estimated cost out of the kind of general fund or additional funds where counties were saying this is the additional cost that we're seeing that we can't cover through insurances or Medi-Cal or realignment. And so that was also kind of presented that shows an estimate of what the budget would need to look at and it was preliminary. It was a really draft budget, calling around and talking to some of the other directors and their facilities. So that is also out there, and that was done, I think, in 2019. So there is some detailed work out there on what things will cost. I think having these positions, while I know there's a lot of concern for them, there's a lot of different ways for us to do them, will allow us to get a better look at those. There are a lot of models. We can say that Mendocino County maybe can't afford these facilities if they're done just by Mendocino County. And I will agree, the fact that we probably cannot run 3 facilities by ourselves without looking at partnerships. And so, as I've said multiple times, there are a lot of different ways to run facilities. We have to run it like a business model, and a lot of facilities work with outside counties. So if we were smart, we're going to be putting a business plan together that really looks at how many beds would Lake County use and what would that bring? And what about, Trinity, or does Humboldt need extra beds? I know Sonoma County does not have a facility currently that they can put Medi-Cal clients in between the ages of 22 and 64. Aurora, you cannot build Medi-Cal for that age range. So Sonoma County has a need for more Medi-Cal available beds. So we know that we have multiple counties right around us that are having to ship our clients, just like we do, an hour to 6 hours away. So a business model would allow us to look at, we don't have to depend solely on Mendocino County dollars. We should be looking at what is it going to be to fund these facilities if we did a partnership with multiple counties. That is a viable option. It's what most counties would do, and it's the way to keep these facilities up and running. If you were to ask me today, can Mendocino County do these on their own? No, we probably can't do all 3 on our own. Could we do 2? It's possible. Can we do 1? Yes, I think we can easily do 1 when I looked at the figures myself. But I would never build this model not knowing that we were going to look with other counties and do a regional model, because that's how these facilities operate and keep financially functional. So I would once again say we do need these positions. I know it's asking a lot at the moment, but for us to do that deep dive, and the great news is behavioral health does have some experts. This is what we do every single day, but we also have a lot of other jobs on our plates, and we can't see especially mental health suffer while we're doing a feasibility or business plan. We are willing to help. And I have been putting a lot of time into helping with this, and I'll continue to help. But I know that Measure B needs the support. Allison needs the support. I do believe we can get, we have the 2016 report. I have my 2019 report. We can pull those together. I think with a little bit extra staffing, we can pull together a really good report and reach out to our other counties and see how many beds would you use, what would that look like, and build what we want in Mendocino County. Thank you.
Okay, thank you.
Chair Haschak.
Yes, Supervisor Williams.
So it's been 2.5 years since Measure B passed, and we don't have a plan. And we have a CEO who doesn't seem to have confidence in our ability to pull off Measure B. Like, start putting the pieces together here. It's not looking good. I think as a board, we need to decide what it is we want to build and operate. And then we need to hire people who can fulfill and execute. But I don't think we can just continue 2.5 years in. We can't continue going off aimlessly with, we're doing architectural drawings to build some structures. We don't know exactly what, we don't know exactly what services will be provided. We don't know where. That's not a good idea.
Okay, going back to agenda item 5L about these positions.
I would like the board to address the information presented by Dr. Janine Miller rather than disregard what she just said. It sounded to me like she offered a path forward that would not be a monumental task. And I would respectfully propose that a temporary extra help employee assisting the Measure B project manager could develop this plan in relatively short order.
Second.
All right. And does that include the 0.25 staff assistant?
Yes, it does, but I believe a motion to reconsider can only come from someone who voted against it, which would mean the chair could make the motion, not myself.
All right. Well, then, if I could pass the gavel to the vice chair. Okay, I'm passing the gavel to the vice chair.
Accepted.
And I will make a motion with this additional new information that came from County Council and Human Resources and Dr. Miller, that we hire temporary help to do analytical work in developing the work plan, and that we also have the 0.25 administrative assistant. And that the resolution should reflect that.
I'm ready to move on, so I'll second it.
Supervisor Jurdy, you're the chair.
Sorry. Any more comments on the motion?
Could we have it read back to make sure that the clerk has captured it?
I have a motion to have temporary help to do the analytical work, developing the work plan, and that there is also a 0.25 administrative assistant, and that the resolution should reflect that. And this is a motion from Supervisor Haschak, seconded by Supervisor Brown.
And who will do the work plan?
Well, that would be the temporary help.
Well,
they were doing the analytical work for it, but if they were to do the plan as well, then thank you.
Well, as acting chair, my understanding is that existing county staff would work with have the support of the extra help staff, and together they would develop the business plan for the options, the various options for new physical services within Matsuno County. So can we have a roll call on the motion?
One more question, if I may, of Dr. Miller. Do you believe, is that something you can work with? Does this move us forward?
Dr. Janine Miller, yes, this is something I can work with and definitely will move us forward.
Thank you.
Okay, roll call vote. Supervisor McCowan.
Yes.
Supervisor Jurdy.
Yes.
Supervisor Williams.
Yes.
Supervisor Haschak.
Yes.
And Supervisor Brown.
Yes.
The motion carries unanimously. Thank you.
All right, I'll take the chairmanship back. And
well,
item
technically,
6.
I believe to County Council, that was the motion to reconsider, and now the item would be back in front of the board, probably the original motion. It's technical, but County Council, I think you have the rule book in front of you.
I would say, strictly speaking, the chair rules on all matters of procedure, but I believe that's consistent with our processes.
Chair, I have a question. Did the chair wish to let county staff, now that they see the vote, sort of effectively a straw vote, work on a revised resolution, and then we could go on to other agenda items and come back with this item after they've had a chance to revise the resolution?
Yeah, that seems totally appropriate. Thank you. So what Supervisor McCown was saying was that we were just voting to reconsider, and is that the straw vote needed to proceed? Is that my understanding, Supervisor McCowan?
Well, yes, the motion to reconsider, there's a very technical aspect to it. And again, I believe the motion to reconsider, when passed, actually puts the original motion back in front of the board. And then presumably the maker of that motion could withdraw it, and we could go to this new motion that's in front of us now. But again, I would defer to county council to make sure that we're in compliance with the rules. Or I guess we could have a motion to suspend the rules. And, you know, one where, I mean, I'm just talking about the technical method of how do we make sure it's legally sufficient. And that's my only concern. I do support the motion.
Supervisor Jurdy, you're the chair of the meeting right now, since we're still on that item.
Okay, my suggestion is that we've given, I think, sufficient direction to the board, to the staff, that the board wants to go in this direction, and we revisit this issue later in the meeting after staff's had a chance to revise the resolution accordingly, and we'll go to other agenda items, including our closed session items.
If I could just...
I support that, and then staff or county council could also determine the correct procedure to follow to make sure we dot all the I's. Thank you.
County council.
Thank you, Mr. Chair. We're also sort of towards the end of the day here. Would it be acceptable to the board if staff were to simply place this on for consent with a resolution reflecting what the board has directed on the next agenda, or is this matter time sensitive?
Consent.
Consent.
All right, I think I've got some direction from the board there. Unless there's any other indication, what we'll simply do is bring this matter back for consent on the next noticed agenda, and we will have a resolution that conforms to the motion here, and the board can then formally approve it at that time.
All right, so we're moving on. Okay.
Well, and I think we did successfully pass a motion to reconsider. And so then this new item would come back as a new item on consent, presumably. Anyway, thank you.
Okay, so let's skip the supervisor reports for right now and continue on with agenda item 5F, which is discussion and possible action, including acceptance of the, we're on to 5G, okay, which is discussion and possible action, including approval of the Mendocino County Lodging Business Improvement District, the BID, annual report, adoption of resolution of the Mendocino County Board of Supervisors declaring its intention to levy and collect an annual assessment from businesses in the BID within the boundaries of the unincorporated portion of the County of Mendocino and the incorporated areas of the city of Fort Bragg, the city of Ukiah, and the city of Willits from specified lodging businesses, and fixing the date, time, and place of a public hearing to be held by the board to levy the proposed assessment for fiscal year 2020-2021. Sponsor is Planning and Building Services. So is Director Brent Schultz here.
Hello, this is Director Schultz, and I would like to hand this off to Adrian to walk you through the bid report.
Thank you, Brent. Good afternoon, supervisors. This is Adrienne Thompson, Planning and Building Services. I'll keep this brief for you. Most of the information is in the board summary. This is our annual presentation for the Business Improvement District's annual report and summary. We will be setting the time and date of the public hearing for the intent to levy with this resolution also coming forward. And we are available for questions that are related to this topic.
Mr. Chair, you're on mute.
Okay, Supervisor Williams, any questions?
No.
Supervisor Brown?
I do not have questions, but I believe, if I remember from this morning, didn't we take one item off consent to be heard with this item, or am I incorrect?
Yes, 4X.
Yes, 4X.
Thank you.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. I have one question and one concern. The question, why isn't Point Arena being included? As we know, Point Arena withdrew from the bid about 4 years ago. Last year, just in advance of the board approving the renewal of the bid, we heard that Point Arena was ready to rejoin the bid, and that would be coming forward as a subsequent action. That obviously has not occurred. Here we are a year later, Point Arena is still not being included. Was there a change in direction by Point Arena, or what's going on there? Why are they not able to be included going forward? So that's the question, and then I have a concern.
If I may, through the chair, Adrienne Thompson, Planning and Building Services. County Council and I had the resolution of intention for Point Arena to come forward and include in the bid on the March 24th board agenda. Unfortunately, the week before we were ready to upload, COVID hit, and we were unable to maintain that board hearing date. And I believe also County Council's on the phone if you have questions. But at this time, we will have to reschedule all of our future meetings to include Point Arena back in. They are still interested, but it's a 3-part hearing that requires the resolution of intention first, then a noticed public meeting with the board, followed by a noticed public hearing with the board, all within a 45-day noticing period to all business owners in Point Arena, as well as newspaper notices that run concurrently. So it will require Matt working with County Council and Clerk of the Board and myself to get these rescheduled again. I apologize. We had been hoping to do this on March 24th, but no one anticipated COVID this year.
Okay,
thank you. So then the concern, and this goes back to an effort that I had made a few years ago to, instead of pay out estimated amounts for the bid, particularly when it comes to the county match, that it would be a better practice to pay the county match based on what the actual prior year bid had been. So now we're in a situation we're asked to pay out an estimated amount, and it does not appear that this amount has been adjusted to take into effect the impact of COVID on the bid collection, which of course would trail proportionately the transient occupancy tax collections. So I'm very concerned going into a very tough budget year that we may be approving the county paying out money beyond the amount that will be required to meet the county match. And this will result in putting both the Mendocino County Tourism Commission and the county in a deeper hole.
Okay. Any response to that, or is that?
This is Marcus Magdaleno, Chair of the Bid Advisory Board.
Yes, go ahead.
Yes, so that is a very valid point that I'm not sure that the board considered when we decided not to make adjustments to the budget. The not making adjustments to the budget and the strategic plan of the original report before the COVID-19 pandemic. The board felt it better to, due to so many unknowns, the board felt it better to not go back and try to make adjustments to the budget or strategic direction until such time that the pandemic was over and the economic damage could be quantified and a realistic estimate of funds generated for promotion of tourism for our DMO to use could be determined. So that's the main reason why it wasn't adjusted. Also, to adjust it would have prolonged the process of getting this report in front of the Board of Supervisors, as it needs to be renewed prior to the start of, as the report needs to be approved prior to the start of the new fiscal year. So that way the DMO will be operating in accordance to its contract and accordance to law. So, but that is a very, very valid point you bring up, Supervisor. I believe that the first, I'm not too familiar with the schedule of when the prepayments go out, if they're going out still monthly or if they've changed to quarterly, just as the collection has changed to quarterly.
If I can interrupt you for a moment, Marcus. This is Adrian Thompson, Planning and Building again, if I may, through the chair.
Yes, go ahead.
We did add a stipulation in the contract that it is an estimated amount at this time, and we will pay actuals off of the assessments that we actually receive. And I've been in contact with MCTC's director, Travis Scott, this afternoon, who also feels that he would not invoice us for payments until he had an actual understanding of what that is. So he's not eager to be overpaid and have to reimburse us money, and we will be paying off of the actuals from the tax collector. So I don't anticipate an issue with this. It is an estimated contract amount. I believe the bid is fine at this point.
Okay. Very good. So any further discussion about this point, this item?
Well, one of the recommendations in the report is that the county appoint an ad hoc committee, which be 2 supervisors and enlisting some county staff to work with the bid. And I understand what Adrian just said about payments would be based on actuals, but this also potentially affects the budget that the county will be adopting, because if we will have to put something in our budget. And so I guess I want to be sure that we're not putting a large dollar figure that will be significantly more than the county will actually be spending in this year's budget if that affects our budget. So what I'm wondering is, can we appoint an ad hoc committee as recommended, working with staff to refine that number a bit, so we're not just putting in a wildly inaccurate number?
Okay. So let's see. I want to hear from county staff, like Deputy CEO Darcy Antle, if that's appropriate, if that's necessary for the budget calculations. And if she can come on at some point. Anyway, okay. And let's hold off. We'll keep that idea, okay, Supervisor Jurdy?
Okay, yeah.
Okay. Any further discussion on this?
Mr. Chair, I wonder if an appropriate motion would be to approve both items 5G and 4X as presented, with the understanding that billings would be based on actual receipts.
Second.
Okay. So it's been moved and seconded. Let's see. Any further discussion about that? All right. Deputy Clerk of the Board, could you conduct roll?
Certainly.
Call vote.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
Supervisor Haschak?
Yes.
Supervisor Brown?
Yes.
And Supervisor McCowan?
Yes.
The motion carries unanimously.
All right. And then we'll wait for Supervisor or Deputy CEO Antle to talk about whether it's necessary to have an ad hoc to work on that as far as budget development. All right, Supervisor Jurdy?
Yeah, thank you.
Okay. Okay, moving on to, well, maybe we should take a break right now. So it's 3:08. Let's take a 15-minute break till 3:23. Right? was a request for a ad hoc committee to deal with the BID and Mendocino County Tourism Commission. And after talking with Supervisor Jurdy, we decided that it was best not to have an ad hoc for that. So we're going to move on to agenda item number 5H, which is notice public hearing, discussion and possible action, including adoption of resolution authorizing submittal of an application to utilize on-hand community development block grant program income for establishing and funding a business assistance revolving loan fund, further authorizing CEO to execute documents associated with program compliance and making loans. Sponsor is Planning and Building Services. So is Director Schultz on the line?
Hello, Chair Haschig. This is Brent Schultz, and we do have this item before you. It's a adoption of a resolution authorizing submittal of an application to utilize our on-hand community development block grant funds, and it's program income funds. It's about $300,000. We want to get your
Director Schultz.
Yes,
I need to do a couple protocol things.
Sorry about that.
So, clerk, has proper notice been established?
Yes, proper notice has been established.
Okay, well, I will open the public hearing and announce the hearing procedures. Board and our clerk will note correspondence and telephone calls received. Have there been any?
All correspondence received has been attached to the item.
Okay, so Director Schultz.
Hi, this is Brent Schultz, Planning and Building Services Director. Good to see you all today. And I just want to bring before you this item. We've generated program income in our CDBG funds, and there's about $300,000 of program income there. There's a great opportunity, we think, to set up a revolving loan fund. We are asking for the board to authorize this, to adopt a resolution authorizing submittal of the application and utilizing these funds in this way. We think it's going to be a great way to help businesses that are struggling through this pandemic. And we want to work with all of our economic development nonprofits in the county. We've already had some meetings with them. I want to point out, though, too, that this is CDBG funds. There's not a lot of flexibility in these funds. I know I get asked a lot, how do we make the feds change the program and make it easier and simpler? But this revolving loan program has really been set up by HCD and HUD. We think we can help 6 to 8 businesses. And we think it's a good thing to do. We'd like you to support this today and have us move along and get this going. And I know Adrian and I, we've been talking again to EDFC and West Company. We think we can do some great programs with this, not only help them get the loan and sustain them and get them through this crisis. And we wish we had more money, but we are going to go after more, and you'll hear that in another item. So I'm here to answer any questions you have, and Adrian's here as well.
Okay, are there any questions from the board? We'll start with Supervisor McCowan. Supervisor McCowan?
I think he's looking for the unmute.
Okay, we'll go on to Supervisor Jurdy.
Yeah, thank you.
Staff, excuse me, Mr. Chair, staff had me muted, so
Okay.
I have no questions. I do support the item.
Okay.
I'm sorry, we did not have you muted, Supervisor McCowan.
I believe you did, because I was speaking with, anyway, we can move on.
Okay. Supervisor Jurdy.
Yeah, thank you. So for Brent and Adrian, these grants from the state, so the program income is money that's already in hand. If a loan is made, and we want to take some risks, if a loan is made to a business and the business is unable to pay, maybe it goes out of business, what's the consequence? Does the county out of the general fund have to reimburse the money on behalf of the business to the fund or to the state? Or is there effectively no consequence in terms of the county general fund?
Thank you, Supervisor. Adrian Thompson, if I may, through the chair. There wouldn't Think of it kind of like a savings account. It wouldn't be repaid necessarily to the county. It wouldn't come out of general fund. This is program income that the county has earned, which is set aside for other CDBG activities. You can only use it for those activities. So it's not earmarked for, let's say, general fund. You cannot use it for general fund dollars. It's only CDBG money. So we're working on what those rules would be based on HUD's guidelines right now with our consultant, who's also available if you should have further questions. We haven't looked too much into, say the business goes out. We have a lot of criteria on loaning, looking at collateral and what would be collected, but it would not be a general fund impact if they did not repay the loan.
Okay, thank you. So it actually, I'm actually looking at this slightly differently, because in the economic crisis that the businesses are facing, what I'm hearing from businesses is, although they are looking at loans and many have taken out loans, many of them are not looking to take out yet more loans. They're really looking for some sort of grant, basically. And so if there is no consequence to the county loaning, say, I don't know, 10 businesses, $30,000, or 100 businesses, $3,000, and if they don't pay it back, if there's no consequence to that, and we've effectively given them grants to help them pay their rent, to keep their doors open, I'm not sure that that's really a bad thing. I mean, maybe at this particular point, that may be the best use of the program income funds, is a bunch of mini grants, setting up some kind of criteria, advertising it widely, and then just keeping these businesses afloat.
Chair Haschik, if I could ask, I believe Jeff Lucas is on the call. Jeff, is that true? If we did say a $35,000 to $70,000 loan, I thought if they retain the jobs over 2 years, it can be the revolving loan can be forgiven. Is that correct under the current HUD rules?
That is correct. So Adrian's points were also well taken. There are certain requirements under the CDBG program when we were looking at these business loans where we have to benefit low, moderate income individuals. And so the way that we do that with the business loan program is by job retention. So the individuals have to meet that low mod income level, which is typically not difficult for smaller business employees of smaller businesses. And so the idea is to provide a very low interest loan, provide it to the business in an amount that'll make a significant difference in the long haul. And then after a 2-year period, allow for forgiveness for the balance of the loan that remains. And so that structure meets the requirements of HCD. Now, your idea of providing funds to many businesses, maybe a smaller amount as a grant, is something that we have talked about with HCD. However, that won't meet the criteria for the CDBG program under the business loan program.
So Jeff, if it was never described as a grant, but it was a mini loan, they were to pay a very tiny interest payment for the term of the loan. Let's say you're saying 24 months, but instead of wiping clean the balance for 4 or 5 businesses, wiping the balance clean for 20 or 30 businesses to spread it out, basically, wouldn't that still meet the requirements of the program, but have an impact on more businesses?
Well, I appreciate your point. That we still would need to meet that low moderate income requirement for the individual in the job, the employee. And so we tried to set it up so that we would get at smaller and medium-sized businesses with a little bit larger amount. There is a possibility, if you take a look at a micro loan program, which is under a little bit separate approach with the CDBG funds, where you could structure loans with a forgiveness clause at the end. I wouldn't, just because of the administrative activities and support work that you need to put into these loans, I could not recommend to you folks you consider anything less than $5,000 as far as a loan amount. It's just that it ends up costing quite a bit to manage it. And that's, of course, why banks don't like to do those smaller loans. I hope I've answered your question.
And Jeff, could you identify yourself, please, for the clerk?
Oh, yes, sorry. My name is Jeff Lucas. We have a small consulting firm named Community Development Services, and our expertise is with the CDBG program and business lending. We've been we worked with the county for many years, been operating for about 30 years, primarily in Lake, Mendocino, and Colusa counties, rural areas.
Thank you.
Thank you, Jeff. And Adrian, I think you answered my question, and it does sound like there would be a way of structuring these loans in smaller amounts and forgiving the bulk of them, effectively a grant over time. I'm just making it clear that that's my preference of how we would structure it.
Thank you, Supervisor. If I can comment through the chair, Adrian Thompson, Planning and Building Services. Right now, we are trying to structure this so it would be only a 1% interest rate. And these will be up to, I believe we're going 15-year loans. They can be flexible amounts. So as you said, it could be smaller, 20 or 30,000. But if they retain a full-time employee for up to every 35,000 that we loan for a 2-year period, the remainder of that loan is forgiven. So that would be 13 years if we did a 15-year loan. They paid on it 2 years. They retain a full-time employee. They are forgiven 13 years of that loan.
Okay. Supervisor Williams.
No questions.
Okay, Supervisor Brown.
No other questions.
Okay, Supervisor McCowan.
No further questions.
Okay. And I appreciate the comments that Supervisor Jurdy made, and I'd like to see those spread out as much as possible. So with that, we'll go to public comment. Deputy Clerk of the Board, is there any public comment?
Any public comment has been attached to the item.
Okay. Duly noted. Okay, staff, do you have any final remarks?
This is Brent Schultz, no final remarks.
Okay. Is from the Board of Supervisors, are there any questions to staff or public? Hearing none. Okay, we'll close the public hearing. Okay, the matter's back to the Board of Supervisors.
Move approval.
Who was that, Supervisor Williams?
McCowan.
Yes.
McCowan? Okay, is there a second?
I'd second it.
Any further discussion? Okay, Deputy Clerk, could you conduct a roll call vote?
Absolutely. Supervisor Williams?
Yes.
Supervisor Haschak?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
And Supervisor Jurdy?
Yes.
Thank you. The motion carries unanimously.
Okay, we're going to move on to item 5I. Notice public hearing, discussion and possible action, including adoption of resolution authorizing submittal of an application to receive funds from the State Community Development Block Grant Program in funding year 2019-2020 and authorizing the Chief Executive Officer to sign related documents. Sponsor is Planning and Building Services. Okay, Clerk, has proper notice been established?
Yes, proper notice has been established.
Okay, I'll open the public hearing. Okay, the board or clerk will note correspondence and telephone calls received.
There's been no correspondence or telephone calls received.
Okay, so we're on to staff presentation. Director Schultz.
Hello, this is Brent Schultz, Planning and Building Services Director. And in January, we were notified that the state HCD, Housing Community Development, had released a NOFA for more community development block grant funding. And for the 2019-2020 year, we want to go after almost $2 million of CDBG money, primarily to help us with our economic development activities, but also an affordable housing project as well. So this application has to get in by June. We will hear in September if we win this award of money. As you can see from the staff report, there's $500,000 for additional micro enterprise technical assistance for West Development Center. There's also that business assistance program is additional monies for a revolving loan. And then the next two items you see there are for our administrative costs to oversee what we've got to do to report back to HUD and HCD on our activities. And then there's money in there for Orr Creek offsite public improvements. They have significant offsite improvements they need help with on their phase 2 projects. I believe it's 40 affordable housing units in that project. They're under construction right now, which is great. And then some general admin for planning and building services to oversee those funds if we get them. So with that, we'd like the board to adopt the resolution authorizing submittal of the application to receive the funds from the state HCD of the Community Development Block Grant for 2019-2020 and authorize Chief Executive Officer to sign related documents and authorize Chair to sign same. And Adrian and I are here if you have any questions.
Okay, Supervisor Jurdy, any questions?
None.
Okay, Supervisor Williams.
None.
Supervisor Brown.
No.
Supervisor McCowan.
No.
All right, so is there any public input on this? Deputy Clerk of the Board?
No, there's no further public comment.
Okay, thank you. So, final remarks from staff.
This is Brent Schultz. I have no final remarks.
Okay, any further questions from the Board of Supervisors? Hearing none. Okay, I'll close the public hearing.
Supervisor Haschek?
Yes. Supervisor
I
Brown?
move the recommended motion.
Second.
Okay, it's been moved and seconded. Okay, any further comments? Okay, Deputy Clerk, could you conduct a roll call vote?
Of course. Continue with the rotation. Supervisor Haschak?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
And Supervisor Jurdy?
Yes.
And Supervisor Williams?
Yes.
Thank you. The motion carries unanimously.
Okay, we're moving on to item 5J. And Supervisor Brown would like to make an announcement with regard to this item. It's a notice public hearing, discussion and possible action, including adoption of resolution establishing agricultural preserve number A 2019-0002 and approving a Williamson Act contract for Lance and Jamie Stornetta in Manchester, APN 133-020-09. Sponsors, Planning and Building Services. Supervisor Brown.
Thank you, Mr. Chair. I need to announce that this is an individual Williamson Act contract, not a consideration covering all Williamson Act contracts in Mendocino County or a Williamson Act ordinance. Therefore, I have no conflict of interest, but we'll need to state it publicly today. Thank you.
Okay, thank you. So I'll go to Director Schultz.
This is Brent Schultz, Planning and Building Services Director. I'd like to hand it over to Julie Acker, our Chief Planner, who's most up to date on this one.
Thank you. So this is Julia Acker-Krog, Chief Planner for Planning and Building. And today we are actually requesting from the Board of Supervisors a continuance of this item to a date certain. That would be to the September 1st, 2020 Board of Supervisors calendar. And primarily that's to allow us to make some revisions to the documents to ensure consistency with the policies and procedures that were adopted by the Board of Supervisors for Williamson Act contracts. And I'm available for any questions that you may have.
All right, any questions from the board? Let's start with Supervisor Brown.
Thank you, sir. Well, basically it appeared to me to be very routine, and I was really surprised to see it's continued. So what changes are you going to be making?
Thank you. If I may, through the chair, Julia Acker-Krog, Chief Planner. So we will be making some revisions based upon the action. Sorry, let me back up here for a second. So the resolution that was adopted by the Planning Commission providing its recommendation to the Board of Supervisors has created some confusion in terms of how the documents are being presented to the board. So in working with County Council and in discussion internally and reviewing the policies and procedures, we determined that we need to make more clarifying statements within the resolution that is in front of the board to demonstrate that it's following the recommendation of the Planning Commission and that the action by the board will be in full conformance with the policies and procedures of the Williamson Act contract. So I don't know if that helps clarify a little bit. There was just some confusion within the record between Planning Commission and board that we thought it would be best to get straightened out to have it very clear in the record going forward.
Well, it seemed very non-controversial to me. It's all a legal issue in language being used. And I just have to state it's not fair to the applicant.
All right, any further comments or questions from the board? Hearing none.
Mr. Chair, I apologize. Could staff briefly summarize the change again?
Okay.
Thank you. So Julia Acker-Krog, Chief Planner. So the change that would be being made is right now the resolution that's presently presented to the board talks about creating a standalone ag preserve contract a standalone ag preserve and then adding to an existing Williamson Act contract. And the idea is actually that we are adding this to an existing Williamson Act an ag preserve and contract. So we're adding it into an existing contract. So staff does feel that it is critical that we make these changes, and it will not impact the applicant in any way as they could not make use of this till the end of the calendar year.
Well, then if the other party to the contract for any reason is no longer eligible, then would that also render this one ineligible?
At this time, we do know that the other contract is in good standing. This is the Windy Hollow Dairy. So there is not an issue here that's presented with this application of it potentially being disqualified.
And so the practical effect, because if it wouldn't qualify, I guess it benefits by being able to add on to an existing contract, but if it didn't have sufficient acreage or production to qualify on its own, it still wouldn't be able to qualify. So I'm trying to see what the detriment to the applicant is.
Thank you, Julia.
Or is there not?
Sorry, so Julia Acker-Krog, Chief Planner. So there's not a true detriment to the applicant here. We have been in contact with the applicant about this, and they were really flexible in whichever direction was approvable based upon the policies and procedures. And staff sees the cleanest option is to add this to the existing contract that is already in place for the Windy Hollow Dairy. And I hope that clarifies.
Thank you.
All right. Any further questions from the board? So you're requesting a motion to continue to September 1st, 2020?
That is correct. That is the next available date that the clerk of the board was able to accommodate us on an agenda.
Okay, so we need a motion on that?
You have to close the public hearing first.
Okay. Okay. Well, for this one, we didn't open it as a public hearing.
Oh, I'm sorry.
Oh, it is noticed public hearing. So, yeah, you're right. Okay, so are there any comments from the public?
No, there are no comments from the public.
Okay. Any final comments from the staff?
I have no additional comments. Thank you.
Any final comments from the board?
I would like to ask County Council proper language for continuing a public hearing to a day certain as September 1, 2020. What would be the language to be used?
County Council?
Thank you, Mr. Chair. First of all, I do want to just clarify that the board didn't open the public hearing. The board simply heard the matter and then continued the public hearing to a date certain, or with the intent of continuing it to a date certain. And I'm just pulling up the language on the recommended motion, but you simply want to indicate that you are continuing the hearing to a date certain and specify the particular date at which time the hearing will resume.
Supervisor Brown?
Okay, so I guess council, we publicly noticed it. If we continue the public hearing to a day certain, we can do that. But you can't take a motion until you've closed the public hearing. But I'm hearing we didn't really open the public hearing.
That's correct. The hearing has not been formally opened. The item is simply here for the purposes of a continuance, at which time the item can be heard at the date certain.
So it'll have to be renoticed. Is that correct? If you don't open the public hearing, you can't continue the public hearing.
If I may, through the chair, we will look at whether there needs to be additional notice. Certainly it'll have to be renoticed in the sense that it will have to be compliant with the Brown Act. Whether there needs to be additional notice in compliance with hearing procedures for the Williamson Act contract, we'll review that, and then I'm sure the department can take care of that if that's needed.
Okay, Supervisor Brown.
I don't have any other comments. I will move to continue this item to September 1st, 2020. So we're not in a catch-22.
Second.
Okay. Any further comment? Okay. Deputy Clerk of the Board, could you conduct a roll call vote, please?
Of course. Supervisor Brown?
Yes.
And Supervisor McCowan?
Yes.
And Supervisor Jurdy?
Yes.
And Supervisor Williams?
Yes.
And Supervisor Haschak?
Yes.
Thank you. The motion carries unanimously.
Okay. Very good. Now we're on to item 6A, which is supervisor reports. So we'll start with Supervisor Brown.
Thank you, Mr. Chair. This last week, many things have been going on, and I'm sure you've all been on conference calls and Zoom meetings as I have. Some of the highlights of my week from the last meeting is that IWPC held their meeting, and the main focus was about the feasibility study submitted to the Federal Energy Regulatory Commission by the planning group. Chair Janet Pauley did an excellent job presenting the information within the study. and she is our prime representative to the planning group. And I want to ask the board if they want to have sometime in the near future a presentation on the feasibility study from Dr. Polly. And we can go on to that a little bit later if you're interested. I also was on a federal COVID-19 call. Also, CSAC has calls with Cal OES, and we're in a specific region. And I was on that last night, and lots of good information presented. So I didn't hear the statistics earlier today during our agenda item, but the statistics shared yesterday afternoon was 80,430 positive cases. We've had 3,302 deaths. We have had 1,292 tests. And as of yesterday afternoon, we have 3,037 COVID patients in hospitals. They did report that the state has received 1 million test kits. So more testing is going to be going on. And I think we all know that's a very good thing. For the attestations, 24 counties have been approved, and there were variances within those approvals. They were granted, and there were variances being discussed on the call yesterday. And any county wanting to submit should do so, but they probably should work with Department of Public Health, with their consultants, and make sure that what they're submitting will work. And probably it would be fast approval if so. They talked about dinner plates delivered, and we had discussed that. FEMA pays 75% of that cost. I believe Mendocino County has an application in, but I haven't heard of it actually being implemented. So FEMA pays 75%. The state will pay 18.75%. So the cost to the county will be 6.25%. Unemployment updates were given. They talked about the CARES Act and money distributed. Anyone with unemployment that are finding themselves as we go into the limited reopening, that they're going back to work and maybe only working a few hours a week, they can go to the EDD website. They have directives there to help individuals know what they have to report back and not lose all their unemployment insurance as a result. Also, the federal update was given by FEMA, and it was reported that Mendocino County, again, only one of four, received $866,000 as a reimbursement back from FEMA. So congratulations to Darcy Annell. Also, the Stepping Up met yesterday at noontime, and the main agenda was the grant, the planning and implementation plan, and almost everyone was there in attendance. And that's it. Thank you.
All right, thank you, Supervisor Brown. Supervisor McCowan.
Thank you, Mr. Chair. I did participate in the IWPC meeting along with Chair Brown. Supervisor Jurdy and I met with the co-chairs of the Continuum of Care and with Director Moss Chandler and Senior Program Manager Megan Van Sant to discuss recommendations for the approximate $140,000 that has come to the county specifically as part of the governor's initiative to address COVID-related homelessness. Again, those recommendations will be coming forward along with the recommendations of the Continuum of Care for their share of the funding. Also, I have submitted a second district supervisor's report. It I had not intended to do this because I thought I had an understanding with staff that we would be calling a special meeting for some time between now and June 9th to consider cannabis-related items, including the item that I had submitted that was approved for the agenda, that was scheduled to be on the agenda for today, and that was pulled by the chair. And I will note that on January 7th, we revised the rules of procedure to provide that the chair is first among equals, but does not have the ability to set policy or direct staff without board approval. So the chair had said earlier in his introductory remarks that he was recommending a meeting in July to consider cannabis. And I know it's the gift that won't quit giving. We kind of wish we were done with it, but we aren't. And I think the reason to have a meeting sooner rather than later, cannabis is actually one of the few discretionary revenue items as shown on Exhibit A for our May 5th budget update, where the revenue projections are coming in at projections. Most other local economic related sectors are down. So the advantage of considering this sooner rather than later is perhaps if we're able to give direction to staff and actually get a more workable system in place, we would be able to reopen the program for what's now called Phase 3 in time for applicants to participate in the 2020-21 cultivation season, thereby generating more benefit to them, to the local economy, and to the county. So I do respectfully request that we call a special meeting for either May 26th or June 2nd to discuss the item that I have attached to my report, and I attach it not for discussion, but as proof that the item had been submitted and accepted by clerk of the board for today's meeting before it was unilaterally pulled by the chair, as he made clear during his introductory remarks. Thank you.
All right, Supervisor Jurdy.
Since last week's meeting, the retirement board met, and it was the last meeting staffed by the administrator, James Wilbanks, who does live in Oklahoma and has taken a financial management job there. And I'm so grateful that the Board of Supervisors today on consent approved the contract for the replacement of Mr. Wilbanks because the retirement system does need a capable administrator. And fortunately, we were able to find someone who seems very qualified, highly recommended. And so hopefully everything will work out really well over at the Retirement Association and with the money being invested. I don't need to repeat the meetings that others have mentioned. Other than just to say that we've had a number of meetings. And as I said earlier, I want to thank West Company and county staff, Dr. Dewan, Carmel Angelo, and others for participating in a number of meetings with businesses, trying to get input as thoroughly as we could. And we have more meetings scheduled. West Company has more meetings scheduled with businesses to get additional input into the website that's being launched later this week. That's it for me.
Okay, Supervisor Williams.
I'll save mine for next meeting. I think we need to get through a closed session.
Okay, and I will say that I attended the IWPC meeting too, virtually. I also participated in a Canatourism virtual webinar. Looking forward to the graduation that Willis High School has come up with that will deal with cars and social distancing, but still recognize the graduates and the accomplishment they've done. And then there's a town hall that the West Company is creating, a virtual town hall on this Thursday, the 21st at noon. And I will have the information on my Facebook and we will try to get the information out to people to talk about economic recovery, especially in regards to food security, plans for the future with the economy, career and technical education, and broadband. So those are the topics we're going to cover. And then, I still propose that we have a special cannabis meeting, and I think that going for July would be ambitious. And I talked to staff yesterday. It didn't seem like there was any problem. It wouldn't affect whether, we would be able to get it done for the growing season for 2021. And so I would like to recommend that we do July 14th and have this special meeting. Hopefully the the COVID-19 crisis is behind us somewhat, and that we can work on some of the issues about technology and input from public, and we can make sure that the public is informed about what we're doing, because this is a very controversial issue. So I'm going to put that forward. I will work with the CEO and clerk of the board to come up with a meeting that will meet everyone's expectations. So with that, we're going to go to closed session, and we're going to deal with items 9A, 9B,
Mr. Chair.
9C. Yes,
Mr. Chair.
McCowan.
Well, I'd like to resolve the issue of when we will have a special meeting. Contrary to your comments that if we have that meeting in July, everyone's good to go for the 2021 growing season, I have an email from staff from February 28th after I had met with them regarding my proposal. And they said, if we start working now, we might be able to have this in place. So we're already cutting it very thin. If we have a special meeting May 26th or June 2nd to give staff direction, if we don't have that meeting until July 14th, given that most or many of the potential applicants for 2020/21 will require an administrative permit or a use permit, we will foreclose their ability to participate in the cultivation season, and we will forego the revenue, as will they and the local economy. I wish we could have more of a sense of urgency about this item. So again, please poll the board and see if there's support to have the meeting prior to July 14th. Thank you.
Well, I know that May 26th is not a possibility because it's right after the big holiday, the Memorial Day holiday. And I think that to do justice to the community, we cannot push this like that.
Mr. Chair, I request you poll the board.
You're out of order. Okay.
Mr. Chair, the rulings of the chair are subject to the board approval.
Excuse me. All right. So I was talking, I think. And so I'm just saying that, according to our rules, that May 26th is not a possibility. June 2nd is still, we're in the midst of crisis. We have staff who are dealing with the coronavirus crisis that we're in. And I just think we have a real problem with the technology and getting public input. I would like to deal with this in July. And I've heard from staff that it's not a problem and it won't affect the growing season. So with that,
Mr. Chair, the rules provide that your rulings may be put to the board, and I would request that you do that as per rule.
Okay, I will put it to the board. And let's see. So the question is, should we go ahead with this July special meeting dealing with cannabis?
Or June 2nd?
I'm asking about the July meeting. So Supervisor Jurdy.
I don't know anything about this other than what you've just said, both of you have said just now. So I don't know enough about whether or not we need to meet in June or in July. I'd like to hear a little more from staff. Staff has not contacted me about this request for a special meeting.
Okay, what I've heard from, okay, CEO Angelo.
Chair Hashjack, are you asking as far as staffing? I apologize, I'm not following as to why you're asking me. We had talked about this. We had talked about no sooner than June, and you thought that July would work. That does work. I will tell you May 26th next week does not work for a special board meeting. But as far as the staffing, as far as the clerk of the board staffing, next week doesn't work. We would do whatever was necessary, but I thought that the issue had more to do with the ad hoc and having the ad hoc ready for a report, which would be the planning and building staff and also county council. So I may have it wrong, but that was my understanding, and I don't know if anybody is still in the meeting, if Brent Schultz is in the meeting at all. So that's my understanding. Maybe I have it wrong.
Yeah, I guess there was two pieces of it. In my point of view, is that there was staffing from the clerk of the boards, and the stress on the executive office staff, and also from planning and building, and the cannabis cultivation ad hoc has a meeting set up for the end of May, early June to finalize kind of the recommendations from February that were sent back for clarification. So that's what I'm looking at. And so I think that it's totally reasonable to not push this, to go for the July date. So that's what I'm looking for.
And Chair Hashcheck, what I would say about June is that most likely, we are getting more cases now, and one of the challenges that we have is that it is the same staff who are attempting to staff the alternate care site, the testing units, and it's the same admin staff that are lending the background support to these efforts. I don't know what June will hold. I don't know what June 2nd will look like. So I appreciate your consideration of the staff. Thank you.
Okay.
Mr. Chair, if I may comment. So again, staff, and I met with the cannabis staff. They were actually enthusiastic about my proposal, which would move in a completely new direction. What I have been told is this is time sensitive if we want to try and get something in place for next cultivation season. I would also say the item is complete, although I might slightly revise it based on staff comments, but staff does not need to do any work to bring this item forward before the board. I do think it's time sensitive. I do think it's revenue generating, and I think that we should move forward. Again, it's not making any ultimate decisions except setting the future direction.
Okay, thank you, Supervisor McCowan. And I think that the Cannabis Ad Hoc, Cultivation Ad Hoc Committee should have a chance to work with staff and come up with, the finalized recommendations that were presented in February. So I would like that regard and respect. So,
well, they're actually separate items, Mr. Chair, and please complete polling the board.
I'm trying to, thank you. Okay, Supervisor Williams, are you up for a July meeting to deal with just cannabis?
I don't know a whole lot about this, but if it relates to scrapping our ordinance and starting from scratch with a more reasonable approach, I support it as soon as staff has time to bring it forward.
Okay, and Supervisor Brown.
Thank you, Mr. Chair. I believe if it's urgent and a simple item, that we should be able, it's not going to impact staff, that we should go forward with the June 2nd action. And I think It would also give a COVID update agenda item so the public can hear exactly what's going on. And I think that is important. We have the attestation that we want to hear back on. That's important. So there's a few items I can see for a special meeting on June 2nd. I also support further business for the July, I believe you said 19th meeting. So I do feel that it is important to have the June 2nd meeting for several reasons.
Okay, and Supervisor Jurdy. So do you have any opinion on this?
No, not much. It sounds like staff is prepared to meet on June 2nd if the agenda item's pretty well finished up.
Well, that's not my understanding because I have a meeting in late May or early June with staff, and because Supervisor McCowan is resigned from the Cannabis Cultivation Ad Hoc Committee, so I have this meeting with the staff, and so I will not be able to have that meeting in time for the June 2nd meeting. So,
Chair Haschak?
Yeah.
I think you might be, maybe I'm mixed up, but I think you're talking about continuation of the ad hoc's work on the recommendations that were given in February. And I think what Supervisor McCowan is talking about is scrapping the entire ordinance, including those changes, and starting fresh with a more lightweight version that would cut down on staff time and would enable revenue recognition. If that's right, I don't want you to waste your time as the ad hoc moving changes forward that are about to be deprecated by a new trajectory. Does that make sense?
Yes, it does. And I'm just saying that in these times when we have very limited staff time, we have communication from the public. We had 0 comments from the public today. When we have an inability to really communicate with the public and hear what their issues are, we're trying not to deal with non-essential items and to deal with something that's so controversial as our whole cannabis ordinance. I think we need to have time. We need to do it right. It's not going to be a 45-minute item, which was what was presented. It needs to be really laid out there appropriately so that we can have a democratic process. And I think that the work of the Cannabis Ad Hoc Committee needs to be considered too.
And if I may,
Mr. Chair,
I think part of the problem is we have an ad hoc that's just Supervisor Haschak. We have Williams and Jurdy, I think, still on a Cannabis Economic Development ad hoc, although we could probably wind that down. We have Supervisor McCowan on a non-hoc. Supervisor Brown is the only one here with enough wisdom to stay out of cannabis ad hocs. Somehow we need to clarify this process. Otherwise, we have multiple people running in different directions with incompatible changes.
Mr. Chair, Supervisor Williams has correctly characterized things. I do propose repealing the current ordinance and letting the state issue permits for cannabis cultivation, with the county focusing on the land use regulation through the zoning code. It would be streamlined. It would stop the endless churning that's currently going on. And if Supervisor Williams will speak in favor of a June 2nd meeting, that would clearly be 3.
I'm fine with June 2nd, so long as staff is capable of pulling it off. And I haven't heard that yet.
Okay,
I heard that they could not do it on May 26th. I think June 2nd would work. Certainly there's ample time to prepare. And again, the item is complete as submitted.
Chair Haschak?
Yes.
This is CEO Angelo. How does the board, what's the expectation of this meeting? And the reason I say that is that as the board has been talking, I've been talking with our clerk staff. We have a meeting set for June 9th, and a meeting set for June 10th. This would be June 2nd, so we would have to publicly notice for 3 meetings in essentially a 7-day period. So what is the expectation of this meeting? Because when we have a cannabis item, we have a lot of interest from the public. It's never a short meeting. So I guess I'm curious as to, is this going to be the ad hoc report and Supervisor McCowan's item? I can't imagine this would be shorter than 5 hours at a minimum with lots of public comment. So is that what we're talking about? And if you really want to have the meeting in June, instead of having a special meeting on the 2nd, can you wait and use June 10th?
If I may, Mr. Chair, first of all, I don't anticipate in any way this would be a 5-hour meeting. Again, we're not making final decisions. We're giving broad policy direction. Do we go in a different direction? We've actually had quite a bit of public comment that would support that. Also, if the board chooses to go in the direction that I'm suggesting, it would have limited value to keep working on tinkering with the existing ordinance. So we'd actually be saving planning staff time. I understand the concern of clerk of the board staff posting one additional agenda, but they now have ample time to prepare for it. And if we limit that to the item that I have suggested and that Supervisor Brown has suggested, we have a known universe of items. Staff will not be in the position, as they often are, of waiting for people to get items finalized. They could have that ready to go well in advance, hit the button to upload, and the agenda is posted. I don't think it would be a huge imposition. And I think, as we've seen, most of our public comment comes in electronically. I don't think this is going to be a 5-hour meeting. When County Council communicated the intention of the CEO to hold a special meeting sometime prior to June 9th, she was recommending it be limited to 3 hours total. I can certainly live with that, and I think we can stay within that. But I doubt it would even go that long. Thank you.
Mr. Chair, if I might, this is Janelle Rao, Deputy CEO.
Yes.
The characterization of being a simple matter of posting agenda for clerk of the board staff is simply inaccurate. We typically have a 2-week turnaround time to review items. If we're only going to have one item on there, perhaps this wouldn't be as daunting as a typical board and an agenda publication. But as it sits, we would be publishing this agenda on the Thursday after a holiday. That's a 4-day work week. We would need those, whatever items were to be considered on that meeting. And if, as Supervisor McCowan is suggesting, it's only his single-paged agenda item and nothing from staff, then perhaps that can be turned around. However, I would encourage this board to consider that we have been having meetings weekly with this clerk of the board staff for 12 weeks. And at this moment in time, we are prepared to have meetings on the 9th and the 10th of June. And this would just be a matter of incorporating an item within that already allocated time. Clerk of the board staff will do and make this happen per the direction of the board. But I do ask that you consider that and the impact that this has had.
Mr. Chair, I can accept that recommendation.
Okay. Supervisor McCowan, if I could speak.
Yes, thank you, Mr. Chair. I can accept that recommendation to incorporate this into the June 10th meeting. It does mean we're going quite a stretch without a board meeting where a COVID update could be presented, but I just make that comment.
And I totally plan to submit the ad hoc committee's recommendations. So it will complicate the issue.
Well, Mr. Chair, again, there's little point in bringing forward an item tinkering with the existing ordinance if board direction may be to repeal it.
Well, we can discuss that on the 10th, I guess, if that's the way we're going. So.
Well, I'd prefer to have the meeting on the 2nd in that case.
Well, is there direction from the board? Hearing none. We will, I'll confer with the clerk of the board and we'll figure it out. Okay.
But
moving on.
However, I do believe at a minimum, my item would go forward no later than June 10th.
I'll support that.
Okay, you support that, Supervisor Brown?
Correct, Mr. Chair. Thank you.
Okay. Is there other support for that?
I would support it.
Okay, then we'll put it on the agenda for June 10th. Okay. So moving on, we will go to our closed session items of items 9A, B, and C. All right. And we will report back at the end. Very good. So I guess we need to all close out of this. Council on?
Yes, I'm here, Mr. Chair.
Okay, we're all ready then. All right, so welcome back, everybody. On agenda item 9A, information was received, but no action was taken. With 9B, Supervisor McCowan made the motion, Supervisor Williams seconded that we appoint Christian Curtis as county counsel. It was approved unanimously. And 9C, County Council.
Thank you, Mr. Chair. For 9C, the board took no action to appoint an interim health officer. However, the board did indicate or did direct the CEO to seek mutual aid from the state. The current health officer, Dr. Duhan, is still in place, still under contract, and will collaborate with the CEO and the state in respect to the mutual aid that is sought.
All right, thank you. And at 5:56, we're going to adjourn the meeting.